Meeting open to the public online. I'd like to welcome all of our members who are participating by video conferencing and to remind members about the protocols regarding the use of electronic devices. Have we any apologies today, Clerk?
Just from Jerry.
Jerry Carroll. Apology from Jerry. Just members aware of any other apologies? No. Thank you. Okay, members, in terms of chairperson's business, I just wanted, I suppose, to share one piece of positive news. I was contacted during the week, and it is great, and it actually is important to remember that despite all the problems that are going on in terms of health at the present time, there are wonderful stories every day of top-class healthcare being delivered to people. And I just wanted to mention one in relation to one that I heard this week in relation to the Southern Trust area, but the acute care at home team and the reablement teams. I had a lady who contacted me just to say about the level of care and treatment she got. And I think that's a heartening story, and also possibly an indication of some of the ways that we could move in terms of developing health as we go forward. The other item that I want to mention then just today is in regards to the general difficult situation that continues out there in relation to COVID-19 and the pressure that's adding, and the need for appropriate measures to be taken at appropriate times to try to protect the community, protect people individually, to try to ensure that the healthcare system and those workers who are so hard pressed are not being put under undue or avoidable pressure. And I think it is something that we need to continue as a committee to keep a close eye on, and to ensure that that we have measures in place that are dealing with COVID-19. It's a dangerous and a difficult virus, and I would reiterate and ask people to continue to abide by the public health messaging, to continue to protect themselves by getting their vaccine, by washing hands, watching their space when they're out, and all of that. So I see a couple of indications there. Just Pam, Deputy Chair, there. Do you want to come in on that?
Yes, thanks, Chair. Really, just on the back of your comments there, I think certainly I had a meeting with the Northern Trust within recent days over the hospital pressures and the concerns that are there, and we know there are huge issues, not least amongst getting people out of hospital who no longer need to be there. Getting those domiciliary care packages in place is a huge issue, and I know that people often don't want to go to other step-down facilities, for example, in between times, but actually there are huge delays, and I've been told that can be up to 10 days that people are remaining in hospital when they no longer need to be there. So I think we need to be conscious of all those issues and raise these issues with the department in terms of how can we ease those pressures on the hospitals, how can we raise those vaccine rates further, how can we more speedily roll out the booster programme to ensure people continue to have protection going forward and reduce those hospital admissions. So I think there are lots of questions that we need to be pushing on within committee as well, asking the department, how we can take all these items forward. I think also too, on the back of the announcements around the COVID certification, we also need much more clarity, and certainly the hospitality industry needs much more clarity on how this will work, how people who don't possess or use smartphones can obtain paper copies. I think there are lots of questions around that, how you prove proof of immunity, proof of negative test, all the practical outworkings of what has been announced. I think really need to be, the questions need to be answered, and those need to be answered quickly so that the industry can make their way through whatever is to come going forward. And I also want to put on record, Chair, my absolute condemnation of the threats to either our health minister or to our other ministers on the executive party, and indeed I want to condemn the pile-ons on social media on individuals. I think that's completely obscene and wrong, and should not be tolerated in any way, shape or form. Thank you.
Yeah, and I think I speak on probably, I'm sure, on behalf of committee members when I say that we do extend our solidarity to all those people who have received threats and abuse, including, disgracefully once again, the minister. episode of abusive language. And while everyone is entitled to their opinion and entitled to share their opinion, no one is entitled to be abusive. And I think that's an absolute disgrace. And it's entirely unhelpful in terms of trying to manage a public health pandemic. So I want to condemn that in the strongest possible terms. And I know that other potentially members of the committee and certainly members of other parties and members of other executive ministers have been receiving vile abuse online as well, and I condemn that all. I'm going to take in Paula and then Carol, just for brief remarks, please, folks.
Thank you, Chair, and I fully agree with what Pam has just indicated there. Chair, I looked at the forward work programme there and didn't see that we have any forthcoming evidence session with the Chief Executives of the Trust. I think that given the pressures in our emergency departments and right across into the hospital wards, I think that it would be really, really appropriate that we would invite them to come before us and talk about how they're going to deal with the winter pressures. Thank you. Okay,
yeah, and Members, I'm sure, will agree with that, and I suppose the difficulty will be the scheduling of it. It's an extremely tight schedule in between times, and I know members are struggling at times. We're now meeting twice a week, and I know that's a struggle and a challenge for members. But we'll I suppose need to see how that could be accommodated. Carol.
Yeah, I just agree with all the remarks, Chair. Regarding threats and abuse, and indeed Pam's right, there are pylons on top of pylons, and it's out of order. And even some of the abuse that staff in our consistency offices took yesterday was just off the chart. But there's more people out there. It's not representative, so it is about perspective. But certainly the threats that the Minister and other ministers and individuals have been getting is just ridiculous. On the same theme around getting the chief executives in, just to share with people, we had a meeting with the Belfast Trust yesterday, and while people are just about coping, it's always just about coping, and we're getting into winter pressures. We need to see what the plans are, and we all need to hear, in my opinion, Chair, from the BMA in terms of access to GPs. This is something that keeps coming up, and it's one of the reasons cited for unusually high numbers of people being referred to accident and emergency when they do get triaged by their GP. And I just think we need to try and get a bit more detail and scrutiny into exactly what's going on, and certainly around after-hour services. Where are they? How often are they open? What is the plan for over Christmas and get into winter months? So I'll just leave it at that, Chair. Thank you.
Yeah, and maybe we can pick up a bit on that in terms of the chief executives, maybe around some of those issues as well. Okay, thank you, members. So moving on then to the draft minutes. I refer you to the draft minutes of the meeting of the 11th of November, which are tab 3.1. Are members content with those minutes? Yep, content. Thank you, members. I also refer members to the minutes of the meeting of the 16th of November, which are at tab 3.2 of your table papers. Are members content with those minutes? Yep, content. Thank you, members. Okay, there are no matters arising, members, from those. So we're moving now to our item 5, which is the Autism Amendment Bill. Evidence from UU, NIHRC and National Autism Society, and I will declare my own interest before we go into this as having previously worked as a social worker and remaining on a leave of absence from one of the health trusts. And any other interest to declare, members? Pam? Yes, Pam, go ahead.
Chair, thank you. Chair, you're breaking up quite badly there, just to let you know. Yes, can I declare an interest as the sponsor of the Autism Amendment Bill before us today, and just to state that I'm obviously here as a committee member and not as the bill sponsor today, but to declare that interest and keep myself completely right.
Okay, thank you, Pam. So, members, this is the first of our evidence sessions on the Autism Amendment Bill today. We will hear from academics from Ulster University, the Human Rights Commission and the National Autistic Society. I refer members to the written submissions from each of the organisations at tab 5 of the pack. I'd now like to welcome by Starleaf Professor Lawrence Taggart from Ulster University. Can you hear me okay, Professor Taggart?
Hello?
Hello, can you hear me okay there, Lawrence?
Yep.
Okay.
Can you hear me?
Yes, we're hearing you there, thank you. We have Professor Roy McConkey, who is also from Ulster University. Can you hear me, Professor McConkey?
I can indeed. I hope you're hearing me. I'm calling from Cape Town, South Africa, and the video is not working on my system, so forgive me.
Okay, so you're coming in loud and clear in terms of the audio, Professor McConkey, so thank you for that. We are hearing you. We also are joined by Miss Alison Kilpatrick, who is the Chief Commissioner in the Human Rights Commission. Are you able to hear me there, Commissioner?
Perfectly well, thank you.
Yep, thank you. Miss Emily Mills, who is Policy and Research Officer with the Human Rights Commission. Can you hear me, Emily?
Yes, good morning.
Yep, and we're hearing both of yourselves there fine from the Commission, thank you. We're also then joined by Miss Sherelle Stewart, who is Director of the National Autistic Society. Can you hear me, Sherelle?
I can, yes, thank you.
Thank you, and we're hearing you. And Miss Sharon McDade, who works within the Education and Transitions Advice Officer in the NAS. Can you hear me, Sharon?
Yes, I can, thank you.
Okay, thank you. Okay, listen, you're all very welcome to our committee, and thank you for coming to the committee and giving us your time this morning. We appreciate that, and we look forward to the session with you. I would just ask all panel members, if you do have a headset, that usually helps with the sound. And also, given that we have a big panel, we have a number of sessions to get through on this bill this morning, if I could ask for one member of the panel to identify themselves as a principal respondent to any questions it might arise, and only if there's additional information that people want to pick up on, if people could follow up with additional information if necessary. But we'll try and work our way through. In terms of members, we will allocate the time out, and I just ask members to be as succinct as possible, given the depth of analysis and scrutiny that we need to apply to this bill, and also if panel members could be as succinct as possible just to facilitate the time. So you're all very, very welcome to Fáilte Valig, Goji and Rin Sláinte. You're very welcome this morning, and I'll go back then to the first named, I suppose, in terms of how people are listed here, is Professor Taggart. If you could identify if you're making remarks or if it's your colleague, and if you're aware of who else is making remarks. But I'll go to yourselves first, and then I'll come to the rest.
Okay, so I'll speak on behalf of myself, Professor Roy McConkey from Ulster University.
Yep, thank you. Okay, go ahead, Lawrence.
So our thanks to the committee for the opportunity to highlight our support for the Autism Amended Bill. We congratulate the Assembly on passing the original bill, which at the time was the most comprehensive piece of legislation relating to autism in these islands. In the intervening 10 years, a great deal of further learning has been accumulated locally and internationally regarding how the needs of children and adults with autism can be effectively and efficiently met. In particular, we want to highlight the contribution that research and evaluation has made to this. We especially support the proposal to have an independent Autism Reviewer, as we see this as a key vehicle by which evidence-based practice can be consolidated within health, social care and educational supports in Northern Ireland. This is essential to furthering the executive's transformation of health and social care services, ensuring more cost-effective use of existing resources, and helping to guarantee that new resources are applied to more timely, local and efficient new forms of service delivery. Since the 1990s, a series of research and evaluation studies has been conducted by Ulster University, particularly by my colleague Professor Roy McConkey, in conjunction with the Health and Social Care Trusts and voluntary organisations. These resulted in improved assessment and diagnostic practices, family-based early intervention strategies, training courses for families and practitioners, and innovative wraparound community supports for transitions to adulthood. However, the uptake of these insights was variable across the trusts and non-statutory providers. A listing of these projects and publications is given in the appendix of this briefing document. An autism hub was established within the Centre for Intellectual and Developmental Disabilities at Ulster University, led by myself, bring together practitioners from multiple disciplines who have identified future research priorities and instigated a number of projects. The Department of Health established a Northern Ireland Autism Strategy Research Advisory Committee, chaired by Dr. Arlene Cassidy, of which Professor McConkie was a member. However, their work was temporarily paused by the Department of Health in March 2018 and has not been resumed, and this is regrettable. A recent analysis of school census data collected in the 4 UK nations has enabled comparisons to be made of the numbers of pupils identified as being on the autistic spectrum. The steady increase in numbers from 2011 to 2019 occurs in all nations, but Northern Ireland consistently has the highest prevalence rates, reaching 3.2% by 2018-19 compared to a comparison by Wales of 1.92%. A further analysis of the consensus data in Northern Ireland showed that Belfast, northern and southeastern areas had markedly higher rises and prevalence rates than the southern or western areas. In all areas, pupils living in locations with greater social deprivation had higher rates of ASD. This information was shared with the Department of Health in October 2017 by NACAR. The variation in a small region such as Northern Ireland is suggestive of inefficiencies within the systems, but this does not appear to be currently being addressed. An Autism Reviewer would help to ensure that research is undertaken into these unacceptable and potentially inequitable variations. In particular, an urgent examination of the costs involved in the provision of assessment and diagnostic services across the 5 trusts is needed, and their operating procedures. Parents across the UK are not satisfied with the support they receive after their child is diagnosed as being on the autism spectrum. Northern Ireland is no different, as highlighted in Broken Promises Report 2017, but attempts have been made to address this. 3 innovative home-based, family-centred, post-diagnostic support to children and families. 3 innovative projects funded by the Big Lottery, undertaken by Autism NI, Cedar Foundation and Positive Futures, provided home-based, family-centred, post-diagnostic support to children and families from 2017 onwards. Detailed evaluations of the outcomes for children and families were made, and these have been reported internationally in peer-reviewed journals. The Healthcare Trust referred around 800 children with the assumption that the services provided. The Healthcare Trust referred around 800 children with the assumption that if the services provided proved effective, the trusts would assume the running costs. This has not happened, and the projects will have been or will soon be suspended. Even when the evidence is to justify the cost and outcomes of the service, it is not acted upon, whereas existing provision continues even when it is not evaluated or the cost not determined. A research reviewer could call commissioners and providers to account. The growing number of children identified on the autism spectrum will invariably mean an increase in the number of adults with the condition who will need support, notably in further education, vocational training, employment and leisure pursuits. A report commissioned by the Healthcare Board in 2010 highlighted the need for action, but many of the recommendations have yet to be implemented. Of particular concern is the increased mental health issues experienced by teenagers and young adults, and the long waiting list times to receive professional help. A project undertaken by the Western Trust and the Cedar Foundation with support from the adult ASD team, has demonstrated the impact that a person-centred, low-cost intervention can make and the potential for preventing more costly interventions being needed. A research reviewer would help to ensure that good practice is shared across Northern Ireland, with preventative projects having the priority rather than investing still on money on secondary and tertiary provision that currently happens. The research reviewer, as the Northern Ireland champion for autism, will be strengthened by being underpinned by legislation. However, the role would be enhanced by the department reviving the Research Advisory Committee with nominees from university, public health agency, trusts and the community and voluntary sector. The Research and Development Office in Northern Ireland could assist in funding research and development projects or signposting applicants, the NIHR and United Kingdom Research Competitive Funding streams. Transnational research projects can be especially insightful. The Northern Ireland Assembly and Information Service could hold copies of pertinent research and evaluations for members to access, and also to be commissioned by Assembly members to collate information relating to issues raised by the research reviewer. To sum up, the amended bill has the potential to reboost more effective, efficient services to people on the autism spectrum. We know what needs to be done. We know what could be done, but the basic problem is that it is not being done. I thank the committee members.
Thank you, Lawrence. And I'll come then to the Human Rights Commission, and just to ask Alison, which of you are going to make opening remarks in relation, brief opening remarks? Is it yourself?
Yes, good morning, Chair. I'm Alison Kilpatrick, the Chief Commissioner at the Human Rights Commission since September. I will be making the remarks. I'm joined by Emily Mills, who's a lawyer who's been working on this and related issues, and she's here to assist with questions if necessary. I will keep my comments brief. I know you're very tight for time. If I can just recap on the core function of the Commission, which is to review the adequacy and effectiveness of law and practice relating to the protection of human rights in Northern Ireland, and in doing that we give advice on legislative and other measures which ought to be taken to protect human rights, and whether proposed legislation is compatible with international human rights standards. And in the context of this bill under consideration, the Commission has considered in particular the European Convention on Human Rights, the UN Convention on the Rights of Persons with Disabilities, the UN Convention on the Rights of the Child, and that part of the Belfast Good Friday Agreement on the right to equality of opportunity in all social and economic activity, regardless of disability. And those are the most directly relevant, but we do also use other instruments to help us interpret the law. As you know, the Commission has a new statutory responsibility under the protocol on Ireland and Northern Ireland, and that's to ensure there's no diminution of those rights protected in the Good Friday Agreement as a result of leaving the EU. Article 2 of the protocol commits the UK Government to keep pace with certain provisions of EU equality law, including the Employment Equality Directive, and that prohibits discrimination on grounds of disability in employment and vocational education. The Commission can say that while there's no breach of the protocol has been identified, the Commission does recommend that the Committee and the Department consider the Employment Equality Directive and continue to monitor relevant European Court of Justice jurisprudence insofar as it's relevant to the proposed autism strategy relating to employment and vocational education, and in doing that ensure that the UN Convention on the Rights of Persons with Disabilities is used to interpret the protocol. Given that autism spectrum disorders come within the definition of disability, and this bill reflects many of the obligations deriving from the relevant convention, we welcome it as being a very positive bill. If enacted, it should ensure more human rights approaches taken to disability assessment and provision, generally and specifically in relation to autism, because the focus is on individuals. The starting point is always the person, not the disability or impairment. Consideration is then given to the barriers that hinder their full and effective participation in society on an equal basis with others. And it's good practice in all public administration, clearly, that citizens have easy access to good information about the system and their particular rights. In the case of disability assessments and autism spectrum disorder assessments and benefits, it's even more vital to ensure that such systems are accessible for users. The UN Convention on the Rights of Persons with Disabilities expressly requires states to collect appropriate data to enable them to formulate and implement policies which give effect to that convention. And similarly, as part of the obligations under the UN Convention on the Rights of the Child, states are required to set up and develop mechanisms for collecting data which are accurate, standardised and allowed disaggregation, and which reflect the actual situation of adults and children with disabilities, including autism. Therefore, the Commission strongly welcomes the inclusion of a proposed duty upon the Department to request health and social care trusts to provide data on the prevalence of autism both in adults and in children. And the Commission's experience in all areas of its work is that really you don't tackle inequalities unless you know exactly what the scale of the issue is that you're dealing with. We're particularly pleased to see the bill promoting the collection of data, followed by the analysis of that data and the sharing of data and information. And that's necessary, we would say, if a human rights approach really is to be adopted, because the strategy that follows must be based on evidence of need, both systemic and individualised. The Commission also welcomes the intention to closely consult with and actively involve persons with disabilities, including children, in the development and implementation of policies, and that is an express requirement of international law. So while Clause 1 of the bill does align with those requirements, the Commission does recommend that the autism strategy compels expressly the Department to involve and consult people with autism spectrum disorders, parents and carers of children and adults with autism, and representative organisations within the sector. And importantly, they should be included not only in the development of the strategy, but in its monitoring and implementation. I can just mention briefly that the Commission and the Equality Commission are jointly designated under the Convention on the Rights of Persons with Disabilities as the independent mechanism for Northern Ireland, and that's for monitoring the realisation of rights in the Convention. For that purpose, we have an established independent disability rights forum to assist us. And while that mechanism is in place, really useful, it is not, we would say, a substitute for the direct involvement of persons with disabilities at the heart of government. The independent mechanism's role is to monitor. But for that reason, we are very interested in Clause 5 of the bill and how that may work in practice, the appointment of the Autism Reviewer, which is very positive in principle. The Commission would be keen to work with the Reviewer, but appreciate more information on how the role will feed into implementation of the Convention by way of the independent mechanism. And finally, the Commission would like to simply restate that the overall purpose of legislation, if it is to comply with human rights standards, must be to promote, protect and ensure the full and equal enjoyment of all human rights and fundamental freedoms by all persons with disabilities. And the reason I say that is that it cannot be limited to health provision. That ignores the individual person and puts their impairment beyond their rights to human dignity. So we would say there needs to be a comprehensive and coordinated approach to implementing all obligations under the Convention. The strategy truly should be cross-departmental and include adults and children. To implement the UN Convention, everything should be considered, including education, housing, employment, health and justice. And we know of the anticipated regional disability strategy from the Department for Community, so that seems to be an opportunity to run the strategies in tandem. There will almost certainly be issues of overlap between the two, and they should complement each other. And really finally, the self-evident fact is that if this bill is to make any difference, the allocation of resources will require close attention. They need to be adequate, coordinated and proportionate, both for the autism strategy and for the overall disability strategy. So unless Emily wishes to add anything at this stage, I'll leave it there and be happy to answer your questions if and when you have them. Thank you.
Thank you, Commissioner. And going then to Chief Commissioner, and going then to Sherelle Stewart, who is Director of NIS. Sherelle, would you go ahead with your opening remarks, please?
Thank you very much for inviting me along here today, and my colleague Sharon McDade. Just to say, for those of you who perhaps are not just as familiar with the work of the National Autistic Society, we're the UK's leading autism organisation. Our aim is there to change the lives of people with autism and their families and improve the support that they get. Just to give you a scale of our reach, 5 million people visited our website last year. We have 116 volunteer branches across the UK supporting 20,000 people. And in 2019 here in Northern Ireland, we opened the first autism centre, which caters for the needs of autistic adults and children and their families. Before I go into the comments on the clauses of the Private Members Bill, I would just like to state that the National Autistic Society in Northern Ireland is supportive of any legislative proposals that will make life better for autistic adults, children and their families here in Northern Ireland. Whilst there is some good work going on across Northern Ireland, autism services are still the Cinderella of services, and adequate funding has never been put in place in order to address this imbalance. During COVID, I presented to various committees in the Northern Ireland Assembly. One of them was on our Left Stranded report, which basically looked at the impact that COVID had on autistic people. And basically that impact has been devastating. And those people who have particularly suffered have been those who have very complex needs. But what I really want to say is that although COVID has basically highlighted those injustices that are there for autistic people across Northern Ireland, but the lack of services and the lack of support has been there for many years, but COVID has brought that to the fore. And just to say, even at this point in time, services still have not been re-established for many autistic people and their families. Respite services are still closed. Quite a number of them have been repurposed in order to house children whose family life have broken down due to the lack of support being provided at this time. Respite or adult day services are still not open and taking people for their allotted amount of time as well. In some trust areas, adults can wait up to 5 years for an assessment and diagnosis, and for children that can be up to 3 years. So I really just wanted to put in context the situation that we are dealing with here in Northern Ireland. The situation with regards to support and services, quite frankly, haven't been tackled adequately, and autistic people, children and their families are suffering as a result of this. I'm just going to go through now some of the clauses of the bill that we had actually provided some comment on. The first thing that we'd just like to say, though very supportive of the bill, that we actually feel that the Private Members Bill have missed an opportunity with regards to training. According to the report Prevalence of Autism in School-Aged Children in Northern Ireland, Annual Report 2021, the prevalence of autism in school children was 4.5%. Given this figure, it is likely that most educational professionals will encounter a child with autism in their career. Autism training is therefore essential to ensure that autistic pupils meet their full potential. These children will become adults and throughout the course of their life will also use health and social care services. The National Autistic Society in Northern Ireland believes that the Private Members Bill should have contained a mechanism to make autism training for educational professionals and health and social care staff mandatory. Health and social care training there are duties in the statutory guidance of the Autism Act in England, whereby there will be mandatory training for health and social care staff. We would like to see that applied here in Northern Ireland. In section 2.4b, the National Autistic Society would question why this is limited to early intervention, which implies only young children. But autistic people are being diagnosed at all different ages, including in adulthood, and need services and support. We feel that this should be rewarded, and we would recommend the following rewording, that the autism strategy must set out how the department is to make provision for an autism intervention and support service. So that would cover both children and adults. Presently in Northern Ireland, there are extremely long lists, as I said before, for children and adults to have an autism assessment. The bill should address this by inserting a clause such as the autism strategy must set out how the department is going to address the length of time persons with autism are waiting for an autism assessment. Section 2.4d. The National Autistic Society welcomes the specific inclusion of adults in the legislation as previous strategies have failed to adequately address their needs. But we would suggest the following amendments: that point D, supported living, should be changed to housing, as there are many different housing options that autistic people may want to avail of, not just supported living. We also feel that there should be a number of issues added to this to strengthen it. We feel that the mental health needs should be added to the list, given the high rate of coexisting mental health problems experienced by autistic people, both children and adults. The physical health should be added to the list, and independent living skills should also be added to that list. With regards to methodology of the autism strategy, the National Autistic Society would welcome clarity as to the meaning of this section. The autism strategy must make, it says that it must take a multidisciplinary approach. And we're not just clear as to what this means within this context. And we would reword this to say that the autism strategy must set out how it will ensure consistency of practice across the health and social care trusts. Also, point 6, the National Autistic Society would suggest that it is not just bodies with an interest in promoting the rights of persons with autism, but should be involved in developing the measurable targets. For genuine co-production to take place, it must also involve autistic people and their families and carers. The Department of Health has set up an autism forum, which is comprised of the voluntary sector, parents, carers, and autistic people to co-produce the next autism strategy. This forum is co-chaired by 2 autistic people. The National Autistic Society would suggest that clarity should be sought around how this forum is consulted in setting those measurable targets. And we should also suggest that there is a role for the Autism Reviewer in setting these targets. Annual autism funding reports. The National Autistic Society is unclear as to how this could be accomplished, as funding for people with autism can come from a number of different sources. For example, if there's a coexisting mental health or learning disability, then it will come from those streams. So there's a bit of confusion as to how accurate those funding reports would be. The National Autistic Society Northern Ireland believes that the autism strategy should come with its own budget, as is in the case in England, which has a £73 million budget for this financial year. What has to be measured is not just how this money is being spent, but the impact of that funding on the lives of autistic people and their families. With regards to the Autism Reviewer, 3C states that the department must appoint a person as the Autism Reviewer. The National Autistic Society would suggest that the Autism Reviewer should be independent of the Northern Ireland government departments to ensure credibility and avoid a conflict of interest. It also states that the reviewer must issue a report annually on the exercise of their functions. We would suggest that the report should be on the progress of the implementation of the strategy. And just with regards to the functions of the Autism Reviewer, as outlined earlier, the Department of Health has instigated an autism forum co-chaired by 2 autistic advocates and comprised of autistic people, parents, carers and the voluntary sector. The National Autistic Society would suggest that the following be added to the functions of the reviewer: to work with the Autism Forum and lay the annual report before the forum, and that they should make recommendations to the Northern Ireland Assembly. So the National Autistic Society is basically stating its support for the private members bill, but we are also asking for a number of additional changes just to be made in order to strengthen what is already there. Thank you. Okay, thank you very much, Sherelle, and thank you to each of our contributors. And that's interesting to hear those different perspectives and useful. So I have a couple, and then I'll go to members' questions. I suppose, and maybe this is either to Sherelle or Lawrence, but how can we ensure that intervention is at the earliest opportunity and for children, and also how can we improve intervention and early intervention for adults? I'll go to speak. Yeah, go ahead, Lawrence. Yeah.
Well, I think we need to identify the evidence-based interventions that have been proven by research, and we need to identify children as early as possible, and then implement those interventions within nursery, schools, Sure Start, and primary education, and work with families. On that now, Professor Roy McConkie has been doing a lot of work, so I'm going to ask him, does he want to develop upon what I've said?
I think one of the issues is if there's waiting lists for people for diagnosis, the intervention of some form should take place while they're waiting. And a project in Fermanagh at the moment is currently doing that, and finding that's a great source of reassurance to families, because obviously the fact that they're encountering developmental difficulties with their child means they already have identified for themselves that there are issues that they're finding difficult to deal with. So we need a system that is sensitive to people's concerns, parents' concerns, and an opportunity for those to be addressed within a family-based context. And the people who are often picking that up would be health visitors, but they don't necessarily have the wherewithal to make any other form of referral other than for assessment and diagnosis. Whereas the project in Fermanagh that Positive Futures is involved in is a project where there are workers trained in autism who can advise the families on activities they can do at home and put families in touch with other families as a way of providing that support. So we have to be imaginative about the type of interventions and not just rely on the statutory services to meet that need, but mobilise that need through the community and voluntary sector, as Cheryl and others have said.
Okay, thank you. Yeah, Cheryl, do you have a comment? Yep.
Yes, I think everybody has alluded to the fact that really children and adults are not being assessed and diagnosed within what would be seen as a reasonable time frame, and this at the moment is still problematic with regards to their ability to access intervention. Intervention should happen at the point where people have been identified as having particular problems. But we have to be really quite blunt about this. There hasn't been enough early intervention services put in place for children, and definitely not for adults. And I think that really, again, there has to be funding put in place, because at the core of all of these issues is a lack of funding for services and support for autistic people.
Okay, thank you. The other question, and I think everyone has mentioned the role of the reviewer, so maybe there will be a range of comments in relation to this question, but how do each of you see the role of the reviewer linking in with other statutory bodies and stakeholders? And indeed, is a single reviewer, is there, in recognition of the complexity of areas that are involved in terms of education, health, training, lots of other areas, so how do you see that role of the reviewer linking in across other statutory bodies? Does anyone want to volunteer to go first in relation to that?
Perhaps, Chair, because the Commission is part of the independent mechanism for monitoring the Convention, perhaps I can make a very brief suggestion that one reviewer, in our view, is sufficient, and in fact there's some beauty to having one single person, so long as you get the right person who's sufficiently independent, but that person is going to need support. So they're going to need backup, they're going to need staff, access to all the departmental officials that they need. In respect of how that reviewer can pull everyone together, certainly the Commission, through the independent mechanism, will be very keen to offer its support and to hear what the reviewer thinks is necessary. But the reviewer should have some official ties, direct ties into each and every department, and should be able to require, I think, the production of information and documentation, etc. The other important thing is that the reviewer needs to have transparent, structured, regular engagement with people with autism. And so it's going to have formal links with those representative bodies and with individuals. So I think if you get the right person, one is enough, but you must support them and give them autonomy and make sure that they have what they need to link in with the sector.
Okay, thank you. Yeah, go ahead. Who's that? Yes, Cheryl.
I would very much agree with that. I think the reviewer has to be independent. The autism strategy is meant to be cross-departmental, so they have to be granted the ability and the power to be able to ask and get information from all of those government departments, and it's absolutely vital that they involve autistic people and their families and carers in the whole process.
Thank you. And I know, and I do
And Chair,
appreciate...
if I might...
Yeah, go ahead. Yes, go ahead. Sorry, Roy, is it?
Thanks, Chair.
Yep.
Yes, it is. I think I agree fully with the notion that there is one person there who has those responsibilities. But we have in Northern Ireland quite a wealth of talent in terms of undertaking the activities and experience of doing it. So it's a matter really of coordination and finding mechanisms where the Autism Reviewer has the support, as Alison said, of the research community, of the practitioner community, and of the service user committee. And I think all of those elements are present and ready to be mobilised. And we need some mechanism to get that mobilisation underway quickly, because that's a big lack at the moment.
Okay, thank you. And Roy, if you could maybe use the raise hand function, just because I can't see you. I'm able to follow indications from the rest of the panel fairly accurately.
Okay,
but
Chair.
if you want to use that function there, Roy, at any point, that might be easier for yourself. Okay, thank you for that. And Sherelle, you have made a number of suggestions there in relation to my final question before I go to members. Was in relation to amendments, and I think you've made some interesting suggestions there, which I think certainly will bear further examination, and appreciate that. Do any of the other members, in terms of the Commission or the academic members, feel that there are other amendments here that would be useful or that suggest themselves to you?
I think in the briefing paper that we proposed, we've made a number of suggestions in relation to how you could use research more appropriate to explore some of the needs of this population going forward, and how to take then this research and implement it into practice. And I think that's one of the difficulties, that there's been good research undertaken, particularly within Northern Ireland, but it's not being implemented. And and this is low cost community intervention, and the Autism Reviewer could hold trusts accountable to ensure that this good practice is implemented within practice.
Okay, thank you. And in terms of the Commission,
if I could add some, I'm sorry. One short addition to that. The Commission has set out in its written submission, and you have that, so I won't add to what anybody else has said today. But I think what I would try and encourage the committee to do is ensure that this is, when you're looking at the strategy, when you're looking at enacting the bill, that you start from a human rights basis. So you're looking at an individual person and their right to housing, their right to education, their right to participate fully in society, etc., despite their autism. So don't confine it to a health and medical issue, but look at fulfilling those people's human rights first. And I think everything else will fall into place. And as Sherelle said, look at the individual first, look at the training of those who are working with them.
Yeah, thank you. And yeah, from my own social work background, one of the training teams I worked in used what they referred to rather jargonistically as a biopsychosocial approach, but it really meant you take every element of the person's life and needs and wishes and ambitions into account, and I think that is the right approach. Okay, listen, thank you. I do want to get to other members, so I'm going to go first of all to Orlia Flynn. Orlia, go ahead. Lanarai Lidahull.
Yep, thank you, Chair. So a couple of questions, and it's just touching on some of the issues that were raised by each of the panels. So my first one was around just on the issue of the Autism Reviewer. I'm just wondering if you actually have a sort of defined understanding of what the specific job role would be for this person coming into post, because I know that people have said that it's positive in principle, the impact it could have around research and working with the Autism Forum. But I think for a role such as this, it's really important that if it is going to be enacted and implemented, that job description is crucial for if it is going to be that one person handling all of that coordination, because it's dealing with quite a lot of issues. Secondly, I think it was Lawrence, when you had touched on some of the research you have identified some future research priorities, but then some of that work then has been delayed and it hasn't been resumed yet, and I'm just wondering where that all sits alongside the implementation of this bill if it's passed. And also you had touched on the inefficiencies within the system, and is that the reason why you would attribute us having the highest prevalence rates here in the north across all of these islands? I would also like to know your thoughts on, are you attributing any of this to the overall issue of health inequalities, and how this bill could maybe help with addressing those health inequalities? And then just finally for Sherelle, those amendments that you have mentioned are very useful. And I'm just wondering if you could elaborate a wee bit more on the issue you touched on, that the mental health needs mightn't be addressed. So specifically, what practical measures could we put in place or add to this to make sure that we're also protecting the mental health needs of those that are living with autism? Thank you.
Okay, well, thank you. Just to say, about 3 years ago, we started an autism research hub at the university that was both multidisciplinary from within the university, but also with across the trust, the health and social, the following statutory sector, and also with service users and families. And we identified 5 hubs or areas that we wanted to pursue. One was health. So looking at the health inequalities of both children and adults with autism. The second was around the education needs of children with autism, but also of teachers and classroom assistants. And already we've started a couple of, with 3 PhDs at the minute. One's around looking at the role of the classroom assistants in primary schools. The second is looking at a whole school approach to autism. And then a third PhD student's actually looking at children with autism in primary school who is transitioning to secondary or grammar school. And we're actually looking at the use of virtual reality. So despite that there's no research funding, we are trying to identify some funding within the university and trying to seek PhD students to carry out some of this work. We have another hub around the use of technology to support children and adults with autism to transition, to integrate into the community. Now that sort of hasn't taken off, but we have identified research areas within the university, but it is restricted to where we get our funding from. And again, I'll just speak about the health inequalities. We have worked with people across the water. We've done a systematic review on the health inequalities around people with autism and also people with autism who have learning disability. And there is a wealth of information to show that people with autism have a range of health, physical and health inequalities, and do not use the health services as efficient as the ordinary members in society. I'm going to ask Roy to come on, because he has been doing some work around early interventions and some of his research on why it's not being implemented. I know Roy's in South Africa.
Just check, Roy. Are you able to come in there on that, Roy?
I hope so now. I can't find my hand function, Chair, so I'm afraid it's the voice I'm having to use. We've been doing an evaluation of innovative schemes in which you're trying to provide timely interventions in a situation that is essentially trying to prevent crises from arising. So the project we talked about in the West with the adult ASD team, again, involved people with young adults, potentially with mental health issues, who were able to be supported into various leisure activities, some employment activities, some vocational training activities. And by doing that through a worker employed, as it's happened by the Cedar Foundation, but with experience, you were working out with existing systems, but linking and signposting people into those systems. So that coordinating function that the individual worker was providing was a way in which families could get timely support, as indeed the young people themselves were getting that support. But again, that project was time limited. We haven't evolved the systems that allow for sustained funding to be provided to these innovative projects. We show the value of them, but because the system is already stretched in terms of models of provision that actually we don't think deliver the goods, then we don't have the money to invest into these new forms of service that are potentially much more cost effective. So we certainly have a systemic issue, And the hope would be that the bill and the role of the Autism Reviewer would highlight some of those inefficiencies and suggest ways in which they can be taken forward and lobby the support of advocates to make that happen. And it has to be said, the frontline professionals are often the people who are also very aware of how the system isn't working. The change needs to be at management and senior management levels in trying to bring about a systemic change in the Transforming Your Care agenda.
Okay, thank you. Was there another element to your question, Orlia, in relation to the job description or the role of the reviewer? Was that picked up on yet?
Well, so I think some of that was touched on there, just about that role that the coordination can play, and that change with the senior management. But it was just finally the wee point with the Sherelle from the National Autistic Society around how we could better address the mental health needs within this bill.
Okay, thanks, Orla, for raising that, because that is actually one of a fundamental problem that isn't being adequately addressed for autistic people. So just to give you an idea of the scope of the difficulties, 94% of autistic adults experienced anxiety. Almost 6 in 10 have said this affects their ability to get on with life. Almost 2 in 3 have a clinical diagnosis of anxiety, and 83% have experienced depression. Now, autistic people aren't, mental health is not a part of autism, but it is coexisting. And I think that what we really need to do is that we have to actually tackle the reasons behind why autistic people are actually experiencing such high rates of mental health. So one of those that I would say is really, it comes down to a lack of support. So for example, if you are waiting really long times for an assessment and diagnosis, you don't actually, you're not getting to grips with what it is that perhaps is bothering you. You can't access the right support. Autistic people are very isolated in society, so we need to introduce programs that will support that isolation, because we all know if you're isolated, that can lead to poorer mental health. Autistic children themselves are more likely to be bullied within the school environment, and within the school environment, they often don't receive the type of support that they actually need. Again, this is a contributory fact, or a contributing fact towards, not good mental health. And there's also a major issue around the mental health services that we actually have in place. So quite a lot of the therapies and interventions aren't suitable to autistic people, and they actually need to be adapted. But this goes back to the earlier point, is that those therapies actually can't be adapted unless you have well-trained practitioners who understand autism, and then they can adapt those interventions in an appropriate way that will enable autistic people in order to access them. We published a mental health guide in conjunction with Mind in order to try and highlight to professionals really how to adapt their practices in order to best meet the needs of autistic people. The other thing that I would suggest is a very practical thing as well. Autistic people struggle to actually access mental health services. So children, we know, have great problems in accessing CAM services, and adults have problems in accessing adult mental health services. And this is because a lot of practitioners will suggest that actually this is to do with their autism, and don't recognise actually that this is a coexisting mental health condition. And just my final point on that is we have funding. There's quite a lot of funding in place for the mental health strategy, and there is it has been slightly mentioned in there about autistic people. But the problem is we have funding for the mental health strategy. We have no funding for the autism strategy, where we should actually be tackling what the causes of mental health problems in autistic people actually arise. So the lack of support, the intervention, the training. So again, we're looking at funding for an autism strategy as well, if we really want to address the core roots of why mental health is a big issue for autistic people.
Okay,
Thank you. Thank
you, and thank you, Arlia. And just to say to members and the panel as well, if there are questions or detailed answers that we don't have time for today, or we're forwarding a written response would maybe do the question more justice, we can do that via the clerk as well. So if members and panel can bear that in mind as well as an option. I'm going now to Colin McGrath. Go ahead, Colin, please.
Thank you very much indeed, Chairman, and I welcome the opportunity to discuss this. I think it's a really important issue. It's something that is very prevalent within all of our constituencies and that we regularly get contact from families about. So I want to commend the bill sponsor for bringing this bill to try and update what we have to try and provide support. And there has been reference to some of that isolation and that community support that's available, and I want to just maybe plug with many within autism diagnosis also having an ADHD diagnosis as well. We have an ADHD hub which is in Newcastle in my constituency that is doing sterling work in trying to reach out and provide support for families and for young adults that have that diagnosis. And I suppose, like many of the services that are provided, it tends to be voluntary organisations, and they struggle to be able to provide the services that they do. And I was just wondering if maybe, Lawrence, from an academic perspective, if there's been any research that's done on the wraparound services that were referenced to highlight how they are supportive, how they are helpful, and to see if there's any sort of backup from the academic world in terms of that, because I think that would help us to put to the department the need to provide support for those services. And then maybe if, Sherelle, if you had sort of real life experience through your organisation of those wraparound services that are available within our communities and the help that they provide.
I'm actually going to ask Roy because he was involved in the wraparound research.
Okay, so we'll go to yourself then, Roy. Thank you.
Colin, you make a very important point. Our systems are so siloed that it is something very difficult to achieve across the statutory services, and the voluntary and community sector have been so much more adept at doing that. So the best of the wraparound services that took place in Northern Ireland, particularly for the early years, was in the Southern Health and Social Care Trust area. And they did mobilise a lot of community support, parent-led organisations, as well as NGOs that were involved in that particular sector, facilitated by the Trust, and the Trust personnel were very key players within that. But the whole concept was trying to re-look at how we provide a point of contact for families through individual workers who then could link in to other services as needed. And that model's been used in many countries for other marginalised groups as a way of bringing services to them. So there certainly is a wealth of demonstration projects that we could point to. But in many ways, I don't put a great deal of faith into changing people's attitudes towards that multidisciplinary, cross-sectorial way of working until they're convinced that the systems need to be redeveloped and reassessed. And sometimes, if you're in a marginalized group like people with autism, despite the numbers, there's still a minority group. It's the dominant service models that's used for the wider population that often then determine what trusts and statutory agencies see as what they can viably achieve. So they're much keener to try and fit in the marginalized, specialized work into their existing framework, where what you're hearing from us is that we need to have a new way of looking at issues for people who have different and somewhat more complex needs. So yes, we do have those models. They have been tried in Northern Ireland, they've been tried internationally, but how we change the system at the highest of levels is really there. And Alison has been emphasising how important we do that from a rights perspective and how we do it from an individual perspective. And then we make our systems responsive to those rights and to those needs. So that's where the transformation needs to come. And goodness knows, we've talked a long time in Northern Ireland about transforming social care in particular. But where has been the will to implement it and start making those changes? Legislation is one approach that we can put some faith into, because that then provides accountability mechanisms that, again, we've been lacking. It's been done informally, I know. We've done it through the regulator, or tried to do it through the regulator, but that hasn't led to transformation particularly. So we're looking now for an avenue that really could make an impact and facilitate that transformation that's been long talked about.
Okay, thank you. And Sherelle, please, then.
I think when you look at services, probably it is the third sector who have actually been more agile in being able to respond to, I suppose, the needs of autistic people and their families. And quite a lot of the services that are being delivered by the voluntary and community sector, I suppose, actually do cover, or they try to cover, the whole sphere of people's lives. So, for example, I mean, we're running a project called Support for Life, which basically, looks at provision for young children. We have education advice. We provide family support. We provide independent skills training. We work with adults in order to try and address issues such as socialisation. And those kind of programmes actually, and I think what's key is that they're put together with the input of autistic people and their families. So it's very much them telling us about the type of services that we need. And I think that's something that really needs to be the key in any kind of service provision. It shouldn't be that autistic people and their families are actually being asked to fit. It's like putting a round peg into a square hole. Really, basically, the services need to be adapted and to be fitted around the autistic individual and their families. But again, the difficulty with the third sector, I suppose, providing those services, is the fact that, again, it's always due to, you go for particular funding applications and you can maybe run those services for 3 years, but then that funding runs out, and again, then you're back into that cycle. So there actually has to be, some continuity, I think, of funding or commissioning of services in order to address these, but at the core, we should be listening to the voices of autistic people and their families and carers.
Okay, thank you. Thank you, Colin. And I'm going then to Deborah. Deborah, please go ahead.
Thank you. And I firstly have to apologise because I have had some very bad technology issues with broadband today, so hopefully you can hear me okay.
Yep, we're hearing you okay, Deborah. Thank you.
Yeah, perfect. I just want to thank the panel for their constructive comments today in relation to the bill. Firstly, I have just a question for the University of Ulster representatives. Are there particular research findings or recommendations from previous studies that the professors would like to see taken forward, and is there scope to address these within the framework of the bill?
I think there's a lot of research, as Roy has identified. He's been involved over the last 10-20 years in a number of early intervention research projects that have been shown to work and to be effective and to be low cost community supports. And as other speakers have said today, the projects are good projects. They're funded for a small pot of money, but when the pot of money finishes, the trust to take them on. So it's about trying to get the trust to be accountable, to say, here's best practice, and this is what should be implemented. So there is a number of projects, like a number of early interventions with families, with individuals with autism, that could be taken on. Roy, do you want to expand?
Yes.
So we're not hearing you, Roy. Just we're going to try that again. Could you go ahead now again, Roy, and try that? No,
he's in South Africa, so.
Yeah, I think we've lost Roy there. So we'll maybe swing back that. I'll check with Deborah if you have another question, Deborah, and then we'll go back to Roy for.
Yeah. Yeah, I do. Thank you, Chair. So do you feel then that there's a need for the Department of Health to urgently re-engage on autism issues, and also then related to that, what do you believe are the main obstacles to ending the regional disparities observed in relation to autism diagnosis, and are these substantively dealt with within the bill?
So I'll go back to yourself first, Lawrence. I still don't think we're hearing from Rai, so go ahead, Lawrence.
I've just come on stream again, Chair.
Okay.
Sorry,
Go ahead, Rai.
my call keeps dropping out.
Yep.
I have more problems than Deborah has, I think. Deborah, the issue has been that the trusts themselves, I don't think they always know what's happening vis-a-vis other trusts. So one of the purposes of having the regular monitoring that the Autism Reviewer might do would be to highlight, even for the trusts themselves, the variation that there is in their practices, and to start the process of discussion around what is the best practice that we should commonly be doing to remove some of these disparities. Because if in the Belfast Trust area there are that number of families and children who need help, then in the southern and western areas they're being denied that help. So in a small place like Northern Ireland, there's those inequities of access. So in some ways, there has to be both an internal process within trusts, questioning what they're doing and how they're providing and meeting needs, but also looking at spreading good practice across trusts. And in my experience, 20 plus years in Northern Ireland, looking at service delivery, we are still seeing big disparities between our trust areas. And even when the department knows it, even when the department recognises it, the Public Health Agency and the Health Board recognised it, nothing gets done about it. So that does need to change, and that's the role of the Autism Reviewer as at least another strategy, another way of tackling that.
Thank you for that,
there as well. Deborah, I think that's why we also suggested in the section within the bill about the methodology of the autism strategy that we actually reword it so that the autism strategy really basically has to outline how it is going to ensure consistency of service delivery across Northern Ireland.
Okay. And Chair, can I just ask just a few final questions?
Very briefly, please, Deborah.
I know we're taking time. Yeah. So, Sherelle, maybe you could take this, and apologies if you've covered this already because my line did drop out quite a bit there. Which bodies outside of the autism sector would you like to see included in the duty to set out measurable targets for the autism strategy?
Well, I think it is the role of the autism strategy to look at intervention right across Northern Ireland. So, I mean, they have to have a role really in looking at things like, education provision. They have to look at health and social care services. But then there are also issues as well, and we touched earlier on the mental health issues of autistic adults. So, things like employability and employment. I mean, these are all key issues that actually impact on people's mental health. So I think that all of those different government departments as well, and the autism strategy was set up to be cross-departmental as outlined in the first Autism Act. And I think that's something that perhaps is being lost within this next strategy. And we need to really basically look at how we address that and make sure that all of those bodies are involved, and that the reviewer actually has access. So, I mean, it's really basically to do, I suppose, with also looking at the role and the powers of that autism reviewer so that they actually can access those health and social care trusts, education, all the different government departments.
Okay, thank you. So I'll need to move on then. I want to check with Carol Nicullen. Carol, are you there for a question? Okay.
Yes, Chair. Thank you. Again, there's a lot has been said. So I just want to appreciate all the commentary. I mean, first of all, and I'll just ask a couple of quick questions. The way in which diagnoses are happening at the minute is grossly unfair, and it's causing additional inequalities. So families are having to pay for private diagnoses, and it's ridiculous, to say the least. So, in your opinion, what do we need to include in this bill to ensure that that doesn't happen? And the international best practice in terms of human rights standards, what else is it we need to do? And my final question, Chair, is we have scrutinised all the budgets come in front of our committee, and we've consistently pointed out that when it comes, the department have engaged in equality screening rather than a full equality impact assessment. And we have made commentary about this, saying that it's wrong, despite the fact that in the screening from the department, disabilities and inequalities are raised between major and minor. And when it comes to children, elderly people and others, they're described even by the department as major. So what can we all do to ensure, through the opportunity of this bill, and it is an opportunity, to cut down on the discrimination, to promote equality, and to ensure that diagnoses aren't based on your ability to pay, but your ability or your need rather than your ability to pay. So thank you, Chair, that's me.
Thank you, Gormagat Marshin, Carol. So I'll go back to the panel with that. Who wants to pick up on those issues, please?
I can just say a little bit just with regards to the assessment and diagnosis. It is unbelievably unfair that the only people that are able to access an assessment and diagnosis is those that can afford to, and that is just such a big inequality. The problem goes back. We continually, it's like firefighting. So back, I think it was in, oh gosh, I can't remember now if it was 2016 or perhaps before it, additional funding was given to address what we identified at that time as a crisis within the assessment diagnostic programmes within Northern Ireland. But it was 2.6 million, which when you spread that across all of the trusts within Northern Ireland is quite frankly inadequate, and nothing else has really gone in there to address that. Now that was for children's assessment and diagnostic services. So and I think that's what you now find is the assessment and diagnostic services for children, the waiting list can be about 3 years, which is exceptionally bad. But for adults, it's even worse because it's up to 5 years, because there was not sufficient money placed into the assessment and diagnostic services with regards to adults. And you'll actually find that whenever you look at the money provided by the trusts for children's services and adult services, that there is a big disparity between the two. Also, with regards to that, trusts are required to report on the waiting times for autistic children, but not on the waiting times for autistic adults. So I think that also has to be addressed as well. So that's just really my initial comments on the question.
Okay.
Carol, can I speak?
Yep.
Carol, can I speak to your last question in relation to the health of people with inequalities and people with autism, and what can we do? In England a few years ago, there was a young man called Oliver McGowan, and he had both a learning disability and autism, and his mother had informed the acute hospital that he was allergic to this medication, and unfortunately when he was admitted into the hospital, he was a young teenager, when he was admitted into hospital, they gave him the medication and he died a horrific death. And she was able to campaign to the Health Committee at the Department of Health in London, and they have initiated mandatory learning disability and autism training. And they're doing an initial project of, I can't remember how many hospitals, but there's something like 40,000 staff in acute hospitals that are getting this mandatory training on learning disability and autism. Now, this is between 3 and 6 hours training. Now, we've just done a recent project with the Health Education Authority, and then I can't remember what the name of it, but we've actually been saying training by itself is not enough to change clinical practice and improve the quality of care of people with autism and learning disability. What has to happen is there has to be a number of systems changes that has to take place, and this is what this bill is about, and this is what the Autism Reviewer's role would be, is to ensure that places like acute hospitals, statutory sectors, put into place a range of systems indicators that will allow staff who get this training, whether it be in education or health, to ensure that the clinical care of people with learning disabilities and autism is implemented. And that's one of the biggest barriers, that we need to change the systems. We need to change the systems. We also need to assess the systems regularly to identify what's not working as well as what is working. And people need to be held accountable to ensure that these outcomes are achieved.
Thank you. And Alison?
Yes, Carol mentioned international best practice. Certainly, it's recognised that people with autism are not enjoying many of their other rights, because if there isn't a diagnosis, barriers can't be identified to them accessing rights, and therefore those barriers aren't overcome. Society isn't putting in place the measures that they need, because they are rights holders in their own right, as are their families, and that's not always recognised, I think. And the way the international best practice and human rights standards would require every policy, law, practice to be screened, so it can be identified if there is a disproportionate impact on people with autism. And it's certainly hoped that an Autism Reviewer might be able to do that. Also linked into that is data collection, and not just gathering the information to identify who needs what when, but reporting on it and monitoring it and reviewing it, and it allows people to be held to account. And linked to both of those, I think, then comes back to the point about training, and I think that really is key. The only way to make sure that autistic people are rights holders and actually get to enjoy their rights is to make sure that those who are providing access to housing, education, health, etc., have been properly trained. And I've seen too many bad practices, I have to confess, where people just simply aren't equipped to deal with an autistic person who may be making an application as a homeless person as well. So the whole thinking needs to be flipped on its head, I would suggest. But there are experts, and you've heard from them today, who can help you to do that.
Okay, thank you. Okay, thank you. And going to Alan Chambers then. Alan, please go ahead.
Thank you, Mr. Chairman. Certainly, over recent years, the public have become more and more aware of autism, and we all know families within our immediate social circles that have members of their families who have autism. So it's great that we have become serious as a society about helping and supporting young people with autism to go forward and live a full and productive adult life. So I certainly back every aspect of this bill, and I think to go back to the situation that Carol's raised, I think that the way we have to address that is to ensure that the capacity is in the system, and that's what we have to work towards, to have the capacity that people don't have to go privately. But just 30 or 40 years ago, I wouldn't have heard of autism, and it wasn't a subject that people spoke about or you read about or whatever. And just for my own personal knowledge, 30, 40 years ago, what was the outlook for young people who had autism? Was it recognised? Did the medical world actually diagnose us as autism then, or did they have some other name for it, or did they just not know that it was a condition that existed?
Yeah, so who wants to pick up on that?
Your point's a good one, Alan. I think what has happened is that we've become more sophisticated at the way we can identify the different disabilities that children might present or the problems they might encounter. So one of the issues in the past was that they were generally lumped together as having some form of maybe intellectual disability called mental handicap or whatever. So we weren't very good at recognizing some of their talents as well as some of their deficits. And it's over time that we've become better at doing that. However, there is still the difficulty with being confident that your diagnosis is clear-cut. So this concept of comorbidities is that often children don't present with a discrete disability, but they have a constellation of difficulties. And when you see a certain combination of those, then you might use the label autistic spectrum disorder, typified more by communication and social disadvantage. But I think what's happening worldwide, and we can see evidence for it in Northern Ireland, is that the risk is that children are maybe being overdiagnosed as being in the autism spectrum, when maybe there's another condition, such as a global developmental delay or a condition ADHD, that may actually be a better way of accounting for what their problems are. So this raises the issue, do we really need a lot of specialised diagnostic services for each impairment condition? Or should we actually be investing in good quality diagnostic services that will cover a range of need? So in Northern Ireland, we set up specialist ASD teams to work with children at the same time as when we had other child development teams working. So we run the risk of actually putting too much resources into the diagnostic process and not having any money left over to help with supporting families post-diagnosis. So the crisis I see is not necessarily the waiting times for a diagnosis, it's the waiting time to get support that's targeted at what the children's difficulties are, and supporting families in helping themselves as well as their child. And that's where the stresses and the strains are within the system. And the solution won't be, I think, more investment in diagnostic professionals. It's more investment in a system that combines assessment, diagnosis, and intervention. And that's where we need a multi-sectorial, integrated approach to make the best use of what investment we have already.
Thank you.
Thank you, Alan. And finally then, Deputy Chair Pam Cameron. Go ahead, Pam, please.
Thank you, Chair. I don't have a question. It was just to restate that my declaration of interest that I'm the bill sponsor for the Private Members Bill, and that I'm here today as a committee member, not as the bill sponsor. And I just wanted to thank everybody, the panel today especially, for their support and their contributions, which I think have been very helpful. I'm looking forward to actually listening to this all back again and really digesting what has been said today and the suggestions that have been made. I think it's very helpful to the bill progress. So just to thank the panel for their attendance today, and to my colleagues and committees for all their questions.
Okay, thank you, Pam. Yeah, and I would also like to thank the panel. And I think one of the things that struck me during the discussions on the various issues was that issue about pilot projects which are demonstrating their worth, but then aren't being continued. We have heard at various times that problem is exacerbated by the fact of one-year budgets. Given that we're now moving to 3-year budgets, I would hope and expect to see a significant improvement in relation to the continuity of some of these programmes of care, which are clearly working for people on the ground. So hopefully that's one element that will address that. And then within this legislation, then whatever other improvements, because I agree with all the comments that have been made, this is an issue that impacts a massive amount of people, but also impacts each and every one of them massively. So it's something I think that we really need to give attention to, and I think it's useful that we're discussing a bill in that context and applying that scrutiny. But I want to thank each and every member of the panel, Professor Taggart, Professor McConkie, Chief Commissioner Alison Kilpatrick, Emily Mills, Sherelle Stewart and Sharon McDade for your contributions and your assistance to the committee this morning, and wish you all the very best in the time ahead. Thank you. Okay, members, I'm going to take really a short comfort break there before we go to our next panel. So if we could come back in about 5 minutes back to resume at 11:05. Thank you.
Programme sound. This is the Northern Ireland Assembly Senate Chamber Programme sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme.
Okay, thank you, members. So we're resuming the Health Committee meeting now in public session, and we're moving to item 6, which is the Autism Amendment Bill evidence from HSE trusts. So this is the second of our evidence sessions on the bill, and I refer members to the written submissions contained at tab 6.1 to 6.8 of the pack. And I'd now like to welcome by Starleaf from the Western Trust, Tom McCarthy, who is Consultant Clinical Psychologist. Can you hear me okay, Tom?
Yes, I can indeed.
Thank you. And Ms Mary McDade, Consultant Clinical Psychologist. Can you hear me okay, Mary?
Yes, I can.
Thank you. From the Southern Trust, we have Denise Carroll, Head of Service for CAMS. Can you hear me, Denise?
Yes, I can indeed.
And Liz McMonigal, who is Clinical Lead in Adult Psychology Services. Can you hear us, Liz?
Yes, good morning.
Okay. We are joined from the South Eastern Trust by Mandy Irvine, who is Assistant Director of Psychological Services. Can you hear me okay, Mandy?
I can, yes, thank you.
Thank you. And Julie Kilpatrick, who's Assistant Director of Children's and Young People's Healthcare in the South Eastern. Can you hear me, Julie?
I can, yes. Good morning, everyone.
Thank you. And then the Northern Trust, we're joined by Ciara McKillop, who is Assistant Director of Child Health Development and Emotional Wellbeing. Can you hear me okay, Ciara?
I can, thank you. Good morning, everyone.
Thank you. And Jane Colville, who is works in the Autism Spectrum Disorder Service and is Improvement Coordinator within that. Can you hear me, Jane?
I can indeed. Good morning, everyone.
Good morning, Jane. And then finally, last but not least at all, from Belfast Trust, Moira Kearney, who is Interim Director for Mental Health and Intellectual Disability. Can you hear me, Moira?
Yes, I can.
Yeah. Okay, Moira, thank you. And Dr. Sarah Meakin, Head of Psychological Services. Can you hear me there, Sarah?
Yes, I can.
Okay, so listen, thank you. That's a very, very extensive and experienced panel, and we're delighted to have that level of expertise at our scrutiny session, our evidence session here this morning. However, it will require, I suppose, careful management in terms of time. So if I could ask panel members if they know who they wish to direct their question towards to do so. If they don't, then hopefully a member of the panel will volunteer or indicate that they will take that question. Hopefully, again, I'm conscious that we have a lot of all the trusts here. I'm conscious there are huge disparities across the trusts. But if people could give a principal answer, and then only if additional or different information needs to be added to that, maybe indicate that. And if panel members indicate with the raise hand function, then I'll try to manage it in that sense. But it could be difficult. I will just ask everyone to be as succinct as possible with both questions and answers, and indeed opening remarks. And I will also say that in the event that we don't get to some of the members' questions, that we can facilitate that via the clerk, putting those questions in writing to the trusts, and we can disseminate that back. And indeed, if answers are complex or long or would benefit from a written response, then if members want to indicate, if panel members want to indicate that, to facilitate just the time pressures within this session, given the scale of issues and the scale of contributions that we're getting. So, having rattled through all that, I'd like to thank you all and welcome you all very much to the committee this morning to Fulcher Row of a Lig. And if I could ask panel members, if possible, to use headsets and to ensure that you're on mute when you're not speaking, as that can have a detrimental impact on the sound. So I'm going to just check with clerk. Are we having opening remarks from each of the trusts? Yes.
Short opening remarks.
So if I could ask for very short opening remarks then from each of the trusts, I'll bring you in the same order that I introduced you there. So I'll go back then to Tom from the Western Trust. Tom, can you or Mary make some brief remarks on behalf of the Western Trust, please?
I think there was a generic opening remark that someone wanted to make. Sarah, do you want to read that out?
Yeah, so if you're happy, we agreed a sort of general statement on behalf of us all, which can then be followed up with each trust as needed.
Okay.
And I've been chosen to give that generic statement.
Okay, go ahead, Sarah.
So I suppose we just wanted to note, and as you've said, in terms of the amount of people that are here, that discussions around autism very quickly reflect the complexity of the diagnosis and also the wide spectrum of need that individuals with an autism diagnosis have. The quote from Dr. Stephen Shore, who's a college professor who has autism, of if you've met one individual with autism, you've met one individual with autism, is probably important to keep in mind. And we know that there's a lot of diversity in the need for support in daily life, both in terms of personal needs, but also the availability of family and community support. We have coexistence of other challenges such as mental health issues or learning disability, which can add complexity to service delivery. And we also need to keep in mind the lifelong nature of autism as requiring a lifespan approach. There is really good collaborative working and sharing of information across the trusts, and those are facilitated by the local coordinator roles, which are invaluable and will be further facilitated by a regional coordinator appointment. All of the trusts have an MDT model of delivery and follow NICE guidelines with respect to autism assessment and intervention. And I think the recent joint working is very well demonstrated over COVID with respect to the challenges of delivering diagnostic assessments, where a task and finish group was gathered to review options and make proposals on progressing a safe and standardised regional return to diagnostic appointments, which has been achieved. I'd like to focus on children's services and then adult services, if that's okay. And I suppose just to note that children's services have predominantly received the focus and the investment. They are fortunate to be driven by strong parental and familial advocacy, and also by the challenges that are experienced in an increasingly pressured education system in terms of meeting children's increasing needs in busy classrooms has also increased the profile and referrals, and work is ongoing to promote working between education and health. These relationships have become much more collaborative over the years, but work continues in developing better integration. There are links between the board and the EA, and at local levels we've got very good working relationships between our educational psychology colleagues and autism services, with educational representation on local autism forum steering groups. While there has been investment in children's services over the last 10 years, the demand continues to far outstrip the capacity, and that remains a significant challenge. And as an example, Belfast Trust has had an average of 70% increase of referrals year on year from the baseline over the last 4 years, which has resulted in a cumulative waiting list tail every year in spite of delivering often above the funded assessments. The capacity challenges include issues of funding, of workforce availability and development, and of the challenge between the need to deliver both diagnostic assessments but also provide ongoing support and intervention. Working collaboratively with our colleagues in the third sector organisations, including the private sector, is a strategy in bridging the gaps in service delivery. However, we would note that these relationships will not in themselves meet demand. We trusts have ongoing and developing contracts with colleagues in the third sector, including private practice, for both diagnostic and intervention work. There is no doubt that COVID has significantly impacted, particularly on our ability to deliver diagnostics, and this can be seen in our increased, which were already challenging, waiting times. However, we would note that we've invested our time into developing and delivering earlier intervention and specific autism intervention supports, and this is reflected in reduced waiting for interventions. We would want to note that during COVID, we've continued to complete assessments and to support families throughout the pandemic, and we've embraced new and innovative ways of working. The opportunities to access support through online resources, virtual Zoom workshops and virtual one-to-one appointments have been very well received by our young people and the families. However, at the end of August 2021, there remained 5,642 children awaiting assessment, with nearly 20% of these waiting over a year at least. And by the end of September 2021, there were 718 children awaiting intervention, although those had significantly reduced and those waiting over 13 weeks due to the move of additional resources towards intervention over COVID. As Trust, we really welcome the development of the emotional health and wellbeing framework with a focus on early intervention, but again would note that a lack of any significant funding will impact on its delivery and the ability to produce effective change. We would note that the framework is not about autism, but acknowledges that in early childhood, children can present with delays and challenges in key developmental areas, and that early intervention at this time has been shown to reduce morbidity later and to enable progression to more helpful developmental trajectories. A focus on this may help reduce some of the autism referrals in early years, ensuring that children and families are still getting the support that they need. We want to note that early intervention, which is autism specific, needs to ensure adequate funding for autism services to allow that better support for both diagnostic assessment but also ongoing, and the need for repeated input over the lifespan for children, young people and their families during the different transitions and changes that they progress through. Adult services are significantly and severely challenged. They do not have any targets and have not received any degree of significant investment in services. I would note that we haven't capitals ever really, and there are not really the same strategic drivers or the loud voices for this population who struggle to advocate for themselves. There are a percentage of adults with autism who will have comorbid learning disability and or mental health needs, and they can access support from those programmes of care. However, other persons with autism who do not meet the threshold for inclusion in these programmes can experience significant difficulty and delay in accessing support, and that can have a knock-on effect on their mental health, also in difficulties in sustaining employment and a history of fractured relationships, which in themselves can impact on emotional well-being. The third sector options are again less available for adults. Adult autism services have experienced a significant increase in demand for these services in recent years. These include demands from young people transitioning from children's services and also an increase in referrals for adults who have not had an opportunity to access diagnostic assessment in childhood. For example, within the South Eastern Trust, there's a predicted 42% increase in referrals for 2021 to 22 in comparison to the baseline year of 2019. The Belfast Trust have year on year around a 300% demand, which is in excess of the capacity in terms of referrals received versus the diagnostic ability which we have, which again results in increasing waiting list tails every year. So there are currently around 1,474 adults awaiting diagnostic assessment and 206 adults waiting intervention. And these are significant waits, with the waiting time for diagnostic assessment around an average of 3 years and the waiting time for intervention an average of around a year. We had a regional workshop for adult autism in September 2019, and a broad range of needs of adults was discussed, noting that at least 70% of adults experience at least one mental health condition. They have significantly high rates of physical difficulties, including cardiology, epilepsy and diabetes, and a reduced life expectancy of around 16 years, resulting in significant inequality. They have high rates of unemployment and economic inactivity, and also high housing needs and issues related to poverty. With all of this in mind, we would be keen to ensure that autism does not continue to be seen as a health problem. The key message in the Autism Act was that autism is everyone's business, but to date it feels as if a lot of the emphasis and challenge is in health. Diagnoses are often sought in order to gain support for learning and achievement in educational settings, or just to support employability. And thus the role of employers and other government bodies in supporting key normative life goals such as jobs, leisure and housing need to be more focused and upheld. We appreciate the time to take this statement.
Okay, thank you, Dr. Meakin. And so I suppose firstly, the responses on the bill and across the board, the responses on the bill indicate that significant resource would be required for the early intervention service. Is that something that you've been working on, and what resource would be required, in your opinion, for that early intervention service? Yep, so I'll go to Tom then. I'll go to the Western Trust just again. I'll work in order. If there's no other order being indicated, I'll work in the order that I have on my list. So in terms of Western Trust, Tom, what's your opinion on that early intervention service, please?
Thank you, Chair. I work in adult services, and maybe Mary can jump in on children's services. This question seems to kind of be focused on children's services, although I do appreciate that adults with ASD also require early intervention. They may have waited a long time to get an assessment and a diagnosis, and therefore the interventions that go with that are needed and timely at that stage. The cost that you're asking about, I would be unable to give that today. If needs be, I can update the clerk with an idea about how funding would need to be kind of approached or looked at in requiring an early intervention for adult services.
Okay, and maybe it will be useful actually, and maybe I'll move on to that, because it would be maybe useful if each of the trusts, and rather than going individually around you now, maybe it will be useful if you could each come back on writing on that as to an assessment of what will be required. I suppose that brings me on in a way to the recent report that the Southern Trust have done, and I commend the fact that the report was done. However, I'm sure you'll agree with me, that's the Being Awesome Autism and Adulthood report. I'm sure you'll agree with me that there are some very worrying figures coming out of it. And I suppose in terms of satisfaction, and dissatisfaction being up around 79–80%, and some other worrying elements of that report. 79% were dissatisfied with access to information, which is a fairly basic, kind of requirement. 79% dissatisfied with the provision of services. But in relation to that report, what comment would you have to make in terms of what the report tells you and what improvements would be needed, and how it would link with the elements of this bill that we are scrutinising today? So I'll direct that to the Southern Trust, please. Yeah, is that Liz maybe in terms of clinical lead in adult psychology services? Or Denise, are you trying to come in there?
Yes.
Yeah, go ahead.
Yeah. Perhaps, Denise, do you want to go first?
Yeah, sure. So within Southern Trust, a huge focus within the autism service is patient and public involvement. And we do have our parenting group that we work with very proactively, and our group of young people right across the Trust, in terms of involving them in absolutely everything that we do. And I do appreciate those responses in the Being Awesome report, that 79% of people are dissatisfied. So, in terms of those figures, it is working with our young people and our adults and our families in terms of ensuring that there is satisfaction right across the board. We work, especially, during COVID, at the start of the pandemic, resources were pushed into online resources and ensuring that we continue to meet the need and the demand of our young people and families. We have a monthly drop-in for families, which is designed by them, and we do strive to do that in conjunction with them. And monthly drop-ins, just of note, Chair, is that we have 200 logins each month, which is designed by the families. And that's 200 logins, that's not 200 people as such. So, we will continue to strive to work with our families and our young people and get full involvement. And that is, Sarah, Dr. Macon touched on at the start, is easier with our children and our families, that, there is huge advocacy support. With our adults, it is much, much harder. They don't have that strong advocate, they don't have that strong voice behind them. So it is harder in terms of reaching out to them and getting them on board in terms of our, working together partnership. And then our parents, we obviously have our parents group that we work very proactively with, Acorns for Autism, and we do a lot of work, and we've done a lot of joint ventures. One example of that is the wall garden, which we have, which is accessible to members of the public, for children and young people and adults indeed. They can access at the weekend, a safe environment for those who have a diagnosis or awaiting a diagnosis of autism within the Southern Trust. So there's lots of co-work being done.
Okay.
Liz?
Yep, and Liz, Liz, go ahead, please.
Yes, thank you, Chair. Thank you, Denise. Yeah, just to go back to Sarah's comment at the beginning, I think the world of service for adults really is incredibly challenging and does need dedicated attention. And Chair, I very much liked your question earlier about intervention. I suppose we would go back a step and kind of consider the importance of adults being able to get timely diagnosis in order to access support and intervention. And one of the things that's fundamentally important in that then is that they can access a spectrum of supports. As mentioned in Sarah's presentation, one of the challenges at the moment is that supports are often predicated on, for example, also having a coexisting learning disability in adulthood or a mental health presentation. So there would be a proportion of people that aren't able to access services and supports if they don't fall within that remit. So it's something we're very mindful of. Thank you, Chair. Thank you, Denise.
Okay, thank you. So I'm going to go then to members' questions. And first of all, I have Paula, Carol, Deborah, Orleah and Colin. So I'll go first of all then to yourself, Paula, please.
Thank you, Chair. I wanted to make sure I got in early today because I didn't want to say that I wasn't interested in the questions. So just my last set were already asked before I got in. I have two questions in relation to one of the submissions. And I think it was the Belfast Trust that were talking about the cost and time implications for providing information to the Autism Reviewer. And I'm just wondering, given technology now, is there no way that systems could be set up that it would be quite simple to extrapolate the relevant information for the Autism Reviewer? And the second issue is in relation to the response around the measurable targets to assess the effectiveness of autism services. And I'm just wondering, is there ever a way in which you're measuring the impact, the negative impact from assessments not being carried out and the appropriate care not being put in place in terms of the deterioration, in terms of mental health, for example, of an individual patient? Thank you.
Yep, so could someone indicate they're picking that up? Paula,
Sorry, it was actually the Western Trust. It was actually the Western Trust put those in.
Okay, thank you.
Good morning. Hi, my name is Dr. Mary McDade, and I will pick that up. Yes, I'll go to your first question, Paula, which is in relation to the information that the reviewer might request. And yes, we deal a lot with our colleagues and information in the Western Trust and produce a significant amount of data, which is really, really helpful in how we manage our services. and we would certainly want to be very thorough and comprehensive in producing whatever data would be required for the reviewer. And in order to do that, there may be additional staffing required. And that was just one issue or one query that we had about that. And it was really just to try and make sure that we would be efficient and thorough in the provision of data. But you're absolutely right, information systems are developing all of the time. And yes, we have very comprehensive information systems in the Western Trust and across the region. So perhaps over time, the provision of that data may become more straightforward.
The second one was in terms of the impact on the patient, the individual, where services are delayed. You know, is that being measured anywhere, or maybe in academia, but certainly in terms of the trust? Is anybody picking that up with the families?
From the Western Trust perspective, Paula, we do have a helpline in place for families that are currently on the waiting list. And we answer many calls on a daily basis, as I know other colleagues do across the region. And we hear every day about the impact on children and on families and on carers. We do our very best to implement some brief services at that point, and we are in the process of developing an early intervention service also. The difficulty that we face is that our referral rate has increased. It has tripled really since 2010. And as a consequence of that, our capacity to see the children in a very efficient way is much reduced. We've got capacity for approximately 420 assessments. And in 2019, we received about 700 referrals approximately. So that therein lies the problem, where we can only see a certain number of children per year. And I'm conscious too of some of the previous speakers this morning, which I find incredibly interesting, but they're also talking about making sure that we're doing effective, thorough, comprehensive assessments that are in line with NICE guidelines. So we need to do them properly. Also, we need to get the right diagnosis to the children. So we're very aware of the impact and also aware of the difficulty we have with capacity at present.
Thank you. Thank you, Chair.
Thank you, Paula. And Carol, Nikhil and Lana Carol.
Thank you. Thank you, Chair. Thank you, panel. So it's quite apparent now that without the involvement of parents and the community and voluntary sector, the cost to health and social care would be a lot more than what it is. But there are constant inequalities for children and indeed adults with autism. So what opportunities do you feel that this bill can help to address those? And secondly, what has currently happened in terms of the equality implications for the waiting lists for 3 years for children and 5 years for adults? And my last question, Chair and panel, is there was reference made to the independent sector as a partner. So would it, I don't get the fact that the ability to pay for diagnosis is being missed, and I don't want to pick anybody up wrong, but what role does the independent sector have? Would it not make much more financial sense to invest in health and social care staff to make these diagnoses? Because at the minute we have additional inequalities on the basis to pay. So that's my questions, Chair. Thank you.
Okay, thank you. So can I ask a member of the panel to pick up on those, one or all of those?
I'm happy to pick up on the independent sector comment. So I suppose the reference to the independent sector was actually where the Trust would contract with the independent sector to help augment our diagnostic capability, so it doesn't produce an inequality in terms of access, and that it's not a, we're not suggesting that people go and pay for their own. It's actually a way of augmenting the Trust capacity to provide assessments. The reason that sometimes we are able to do that would be, for example, if we have a vacant post and are in the process of recruitment, or if we have someone on maternity leave and have difficulty getting temporary backfill, then it's a way actually of making sure that we are making best use of the funding that we have available. by being able to, in the short term, actually purchase additional sessional input. Where we have long-term funding, we always look to recruit permanently to those posts, but there can be, due to workforce issues, a delay in recruitment, or we might have, for example, someone on maternity leave and not a permanent post to advertise in. So in terms of the reference to the independent sector, that's what that was in connection with.
Thank you. And then in relation to the other questions, could a member of the panel pick up, please?
Chair, perhaps I could comment on the issue of inequality between adult and child services and waiting times.
Thank you.
As the question noted, there is a significant disparity between waiting an average 3 years for a child assessment and an average 5 years for an adult assessment, both of which are clearly completely unacceptable from a service user and family perspective. However, I would advise that the reason for the disparity is that the two services are funded separately. They're commissioned by two different departments within the board, and so there isn't a consistent requirement for the services to have a similar waiting time. I would also note that there is a ministerial target for waiting time for children's services, but not for adults. And I do feel that has been to the detriment of adults, whereby without a ministerial target, there has been a significant drift in waiting times for adults and a lack of focus thereon. Thank you, Chair.
Okay, thank you. And Carol, what was the final question that you had there? And I'll ask somebody to pick it up then.
Sure, it's really just around the ability to pay in terms of people having to go to the independent sector to get diagnoses, either for their children or for their adult children. What are we going to do to reduce those inequalities for families?
Yep, I see Sarah indicating there, and I think the other part of that was around the desirability of having core health and social care staff rather than outsourcing it. Yep, okay, Sarah, I see your hand up there. Thank you. Go ahead.
So I suppose just hopefully I've answered in terms of why we would, as a trust, actually go to independent sector. It is also a reality that there are families who do go and pay for their own assessment, and that has been something that we have all discussed over time. At one point in time, we didn't accept independent assessments as trusts. However, that kind of also felt a little bit, I suppose, like we were kind of challenging our own weights in some ways. At least it moves some of our people off our waiting lists and allows us to progress with greater ease, and the sort of an inequality in itself in not accepting the assessments. So we did make a decision, but the assessments are only supported if they're done in accordance with the NICE guidelines. So I suppose we're trying to address inequalities at all levels. Ultimately, we do not have the capacity to meet the demand, and that's the only way that the inequality would be fully sorted.
Okay, thank you. But just to pick up on that point, are there measures being put in place to develop the capacity rather than simply outsourcing, Sarah, in your opinion?
So we have a plan to recruit to the posts that we have vacant, and are progressing with that. As we outsource, we actually build capacity internally, which means that people get their assessments quicker. But where there are vacancies, I think I probably speak for everyone, we move to progress to full recruitment. But even when we have full recruitment, we do not have the capacity to meet the demand that is at our doors. And therefore there continue to be long waits. And even with the outsourcing, I suppose the point I was trying to make earlier is even with using our community colleagues and any private sector availability, that still does not fully meet the demand in terms of the waiting list that we have.
Okay, I'm going to move on then, thank you. So I'm going then to Deborah. Go ahead, Deborah, please.
Thank you, Chair, and thank you to the panel.
I have two questions. Really, the first one's to do with the Western Trust, and I believe in its written evidence it supports the placement of an autism reviewer within the existing structures. Can someone maybe make comment on how the independence and scrutiny roles could be protected in this scenario, as well as across the developmental remit of that role? And then following on, just in terms of early intervention, the Western Trust states, that the current resource does not meet the current level of demand in terms of early intervention. And we have talked about there the importance of that due to studies showing, that working with parents and young children can offset those numbers. So really my questions relate to, what does that early intervention look like? How quickly would we like to see early intervention happening? And what blockades are there to that? Is it workforce is a main issue? So maybe if someone could pick up on those points, please.
Thank you.
Hi, I'm happy to pick up on the early intervention query, given that we made that response in the document that we submitted. The early intervention is absolutely critical. We believe, certainly as clinicians, there are many stages at which early intervention is important. Early intervention is important at the very first time that difficulties emerge in a child, and that may be very much pre-diagnosis. Early intervention and timely intervention is also important as the diagnosis has been made, for families to get themselves used to that diagnosis and to adjust to it. There's also another stage where early intervention is really important, and that is as a child is developing the diagnosis of ASD, they may meet many new challenges along the way, and they may require additional support. So they may have received their diagnosis at the age of 4, but they might present to services at the age of 14, facing new transition and new challenges. And at that stage, they also need early intervention, and by early intervention, I mean timely intervention. Early intervention is also specialist because it should be provided to children in an individualised way based on their presenting need. So it often requires specialist formulation to ensure we get the right intervention for that particular child and that particular family. So you'll have seen what I'm saying in that that will require quite a substantial resource given the volume of children that we have coming to us at the pre-diagnostic stage, the volume of children we have with a diagnosis, and the number of children that return to our service as they develop over time. We currently have got 4 members of staff who are available to provide early intervention, and certainly based on our capacity analysis, we would feel that we would need a lot more additional staff to provide that intervention. We do have very close collaborative working arrangements with our voluntary and community sector, and they also support us very well in the provision of early intervention. However, again, we would need some consistent recurring funding, I believe, to ensure that we could stabilise the service and make sure that early intervention can occur for families right across the age range. Thank you.
Yeah, thank you. And then was there another element to Deborah to your question?
Yeah, maybe if I can come back there on what Dr. McDade said there in terms of 4 staff. How many more staff do they think that they will require? But also then I'd asked in terms of commenting in terms of the independent and scrutiny roles in terms of the Autism Reviewer, and the Trust saying that they would maybe support it being within their existing structures.
Deborah, in terms of the cost and the additional amount of staff required, I would certainly appreciate some time to come back with a more well-developed answer than thinking kind of on the spot right now, if that was okay. Mm-hmm. The other one in relation to the reviewer, I suppose we were thinking when we had our discussions within the Trust that there are currently there's a lot of reviews ongoing in relation to ASD, and we present a lot of data both to the department and to the Health and Social Care Board, and that data gets reviewed and analysed. So we wondered whether the current kind of review arrangements could perhaps fulfil that function. There's also other reviews across children's services like the Children's Commissioner and the Ombudsman. So, I mean, again, I personally don't have very strong opinions on it, but we were just wondering in an attempt again to kind of prioritise clinical services, whether it could be accommodated within existing structures.
Okay, thank you.
Okay, thank you, Deborah. And I'm going then to Orlia Flynn. Go ahead, Orlia, please.
Yes, thank you, Chair, and thanks very much to the panel. So I suppose first and foremost, maybe it would be a question to each of the trusts. I'm not sure. I just think that it's up until now, some of the presentations, and I'm conscious of the limitations of time, but it has been very light in detail and commitments in relation to what we're talking about. And I know that earlier one of the doctors had mentioned the overall difficulty that you are having with capacity at present, you know, which obviously is a genuine concern for, you know, within your own capabilities and within the waiting lists and how you are the delays with treating people. But in your opinion, should workforce be an issue, you know, contained within this bill, within the strategy? You know, is there anything more specific that we can be containing within this to try and obviously assist yourselves in the work that you are doing? And then just to go back to maybe more specifically to the Belfast Trust and Moira or to Dr. Meakin, if you could expand on some of the comments that was made in your written submissions around the confusion that seems to exist or the need for further clarity around the autism early intervention as contained within the Children's Health and Emotional Wellbeing Framework. And my second question to the Belfast Trust specifically is, it's just to go back, Dr. Meakin, to the issue of the independent sector and the private diagnosis and referrals that are coming into your trust. So I know that the collection of data has been really poor to date on that. And I would just like to ask, why is that not recorded? You know, the number of private referrals that are coming into your trust and that are accepted by the trust. And how many are we actually talking about? Because I think that when we are talking about, you know, health inequalities, I think the fact that you are having that difference made where people can pay to get a diagnosis quicker as opposed to someone who's waiting years on the list, that is a massive health inequality. So if you could elaborate a wee bit on that. Thank you.
Thank you, Orlia. So I'll go to Dr. Meakin there. I seen your hand had been up, Dr. Meakin. I'll maybe go to you first just to check were you looking in previously and then to pick up on Orlia's questions there.
No, so thank you, Orlia, because your question is really helpful. It was actually to do with what my hand was up about in terms of the discussion around early intervention. So I think one of the things that we had commented on was just the importance of really understanding what the ask was in terms of early intervention. I think Mary, Dr. McDade has kind of been very helpful in terms of looking at kind of the different types of early intervention or the different ways in which early intervention can be delivered. And I think in terms of any potential new bill, I think that probably the question for us would be we would need a much better understanding of what the ask is in terms of early intervention. I think particularly if we're looking at kind of costs, etc. I think Dr. McDade's point in terms of, you know, early intervention, it really spans from input into kind of perinatal issues, early infancy, right up to post a diagnosis being made. And the emotional health and wellbeing framework is really focused not on autism, but looking at the fact that children can present with challenges in their sort of development from early times, and that doesn't always need to move towards an assessment for autism in order to be supported. And I think the aim is really to move towards a more needs-led basis of providing support rather than to a diagnostically driven system, which is very much what we have now. So I think that was our kind of ask in terms of the discussion around early intervention, and would still be for me as to what is the requirement. Is it about that early intervention framework, which is much broader, includes the kind of role of our colleagues in health visiting and in other aspects of children's service delivery, rather than just a focus on autism? Or are we looking at early intervention in someone who has a diagnosis of autism, and those are two different conversations, which sometimes get a little bit kind of joined up, and then can be difficult to look at what the needs actually are. So I think some clarity, particularly in terms of any new amendments to the bill, as to what exactly the early intervention looks like and what the desired outcomes would be an important aspect for us of that as well. In terms of the collection of data around private assessments, I suppose it's not part of the data set, and maybe that's not really a kind of robust enough answer. I'm not sure how difficult it would be, in honesty, to go back and try and get that data. It's certainly I can look at that, and we can take back into the trust to see whether we can look at the kind of numbers that would come in for information.
Okay, Dr. Meakin, thanks very much, and that would be much appreciated if you could take that back. And I'm just wondering, because we do have obviously all of the other trusts on the call also, is there any learning that the trust could share between one another on this? So I'm not sure if the other trusts want to come in to comment on whether they record private diagnoses, and if not, could they commit to do it or to look into that? Thank you.
Yeah, so we'll go trust by trust there. Just a quick question from Orlia in relation to each of the trusts. So we'll start with the Western. Do you record, and if not, why not? And what are you doing about that?
It's Tom McCarthy here. In relation to private diagnoses, no. As an adult service, we do not keep a record of it. It can be kept. I know that the figures are very, very small, so it wouldn't be an issue going back and finding those figures. Mary, from your perspective on the children's service, do you want to mention or comment?
On the children's perspective, we currently do have a very small contract with an independent provider using non-recurring funding, and we do record the number of children that we send that direction. What we don't record currently, but certainly have no issue in recording it, is the number of self-funded assessments that are completed.
Thank you. And Southern?
Yeah, so from a children's perspective, we don't currently record that. So that is a manual recording as we get private assessments into the trust. We don't have the systems to capture that electronically, and we use electronic systems currently. And as Dr. Meakin has touched on, it's not currently part of the data set. Although numbers are small, and we have begun to look at those and take those into account. To look back to see how many we have accepted into the trust would be a manual trawl, and that would be quite significant given the numbers in terms of teasing that out, the difference in a trust and a private diagnosis. Liz?
Thank you. Again, we don't capture it from the adult side, but what we have developed is some kind of criteria to look at considering diagnosis that they meet the professional guidelines and the NICE guidelines around that. It's not a significant number, so certainly we could capture that data, but we don't see a significant number of private diagnoses coming into adult services.
Okay,
thank you.
Southeastern, Mandy, please, and then Julie.
Again, as mentioned by trusts, we don't currently have a high volume of people assessment. It certainly can be captured, and I would suggest it could be added to the monthly data set that is routinely completed and returned to the board, so that information can be accessed. I would note that there's probably two issues. One is the inequality, so financially, individuals being able to afford to pay for private assessment. I would also suggest that there perhaps is inequality insofar as if someone pays for private assessment, they often are guaranteed a confirmatory diagnosis, and the trust has focused upon ensuring the quality of those assessments, as has already been mentioned. I would also just finally comment that from an adult autism perspective, many people may choose to pay for a private assessment and then use that information to access benefits or additional supports within employment, etc., but not access trust services, and we would have no way of capturing that data. Thank you.
Okay, thank you. And Julie?
And in terms of Children's and South Eastern Trust, we don't formally record. We do know the numbers are low, so that would be easy to trawl and to actually capture, and we would be happy to do that.
Okay, and Northern, Ciara, please, and then Jane.
Like the other trusts, we don't routinely record private diagnosis. It's a very small number. I suppose I would comment that the independent sector are largely trust staff who are working additional hours. So in the Northern Trust, what we have tried to do is to use overtime where we've had additional funding or small pots of non-recurrent money just to increase capacity.
Okay, and Jane?
Okay, within it. Then again, like the other trusts, we do not routinely collect that data. Again, like other trusts, those numbers would be low, so it's something that could be picked up on.
Okay, and I know we have heard from Sarah in relation to that, but Moira, do you want to pick up on behalf of Belfast Trust just finally?
Just wanted to continue on with the comments that yes, easy to add. Happy to have them on.
Okay, I'll go back briefly to yourself, Orlia, please.
Yeah, no, Chair, just to thank the Trust for all of that feedback, and I do think that it's helpful because obviously, given the context of the conversation that we're having around the families that are under extreme pressure on these waiting lists, and the young people and old people that are on the waiting list. So I think it's good to actually have that feedback and to hear that feedback for the public to have that information. So and I think it's also a positive the fact that although the data sets don't allow and your systems that you have in place don't currently allow for that, if it is straightforward or easy enough to try and gather some of that data, it would be muchly appreciated if you could feed that back into the committee. So thank you very much.
Ciara?
I suppose, Chair, I just wanted to make the comment. I know there's a discussion about inequality, but it's important to note that we don't exclude any child from any service because they don't have a diagnosis, and that when we're offering intervention to children, they don't need a diagnosis to be able to access that, and I think that's important to note as well.
Yeah, although I suppose the other side of that particular coin is that do you know the correct services or the range of services that might be required if you don't have the information? The other thing that strikes me from that part of that session is that you're all saying it's very small, but you don't know what it is. I don't understand how you know it's so small in that sense, but it's clearly significant, and across the north it has been previously reported on as significant, and it's also having a significant impact on those that are caught up in it. And the Minister has, in relation to previous committee correspondence, has agreed to look at this issue. So I'm kind of a bit surprised that if it's a question of adding it to the data set as to why that hasn't been done, and I would like that, and I know some of you have committed that will be done. I think that's appropriate, but I think every trust, I think we need to iron out this element of postcode inequalities across various areas, and if we don't, what doesn't get measured doesn't get done. It's as simple as that. And if we're not measuring this, and we're still not measuring it after it's been raised by committee quite some time ago, then I would be concerned about that. But anyway, I need to move on. But that is an issue that I think we will want you all to come back to us on in terms of what is being done to address that. I'm going to move on then. I'm going to Colin, and then we'll finish up with Alan. So Colin, go ahead, please.
Thank you very much, Chair. I suppose I know we're getting towards the end of the session now, so really it's put myself on there as well, it would help. I know we're getting to the end of the session, but maybe just something that I wanted to ask the panel for their perspective on. We've 10 presenters, 9 of which are female and 1 that's male. Is there a sort of shortage within the sector of males working within it, and does this have an impact, given that obviously I'm sure that there are quite a number of young men and older adults that would be diagnosed, and what maybe could be done to try and attract people into that, and even if as well in terms of being able to try and improve the service, does anybody have a really good piece of and a good example that they have done that has maybe helped to get a quicker response time? I mean, are there initiatives out there that could be shared around? Thank you.
Yep, so who'd like to pick up on that?
I could just mention, just being the only male here, I don't know if being only male is today is reflective of all the teams. I don't know about all the teams, but there does seem to be a higher number of females. Does that have an impact on kind of the services that are provided? I would be unsure about that. Certainly there seems to be more of a bent towards males getting a diagnosis of autism than females, and there's consideration and concern about females getting a diagnosis. So therefore, having more females in services might assist in that issue. But I think the issue of gender, I'm not too sure how much it impacts on the overall provision of service. I think it wouldn't do an awful lot, but I do understand that sometimes when people come in, and this happens to me being a male as well, that sometimes females want to work with females, sometimes they want to work with males. I think it's good having a balance between services, but I'm unsure about how much it impacts fully on the service that is provided.
Okay. Thank you. Are you okay there, Colin?
Yeah, that's grand, Chair. Thank you.
Thank you. So I have Alan and Pam then. So Alan, go ahead, please.
Thank you, Chair. Just two questions maybe for the South Eastern Trust representatives. And the first one would be, do they consider that investment for autism services has, over past years, has kept pace with the need, as evidenced in the Department of Health's annual prevalence report? And my second question is that I note that the particular emphasis that their written evidence gives to regional coordination. Do they accept that this need for coordination extends to the need for independent scrutiny and the commissioning of, say, practice-based research to problem solve current challenges? Thank you.
Yep. So go ahead, either Mandy or Julie, please.
Alan, thank you for your question. I suppose I can answer the first question. Has the funding kept pace? No, it probably hasn't, or definitely hasn't. We have seen significant increases in not just the number of referrals for children into autism services, but actually a significant increase in the complexity of those children. And we work in the South Eastern Trust as a large emotional health and wellbeing service. So we have a single point of entry, which is multidisciplinary. So that sits twice a week. Each week we have between 60 and 70 referrals on each of those days. And we have developed complex pathways. So the multidisciplinary team sits and looks at each of those referrals and then decides, based on the information provided, which pathway each of those children need to go to. So we have a significant amount of data and an ability to track the information that came in and what happened with those children during their journey. Absolutely, we could do with more and more and more resource in order to make capacity. And we have, talking about early intervention, we actually stepped out a number of years ago and built up a partnership with Bernardo's in terms of ABC PIP, and that is around infant mental health, and that is looking at that early intervention and hopefully prevention of these children, coming into our services later on and late diagnosis. But absolutely, we have a lot of ideas of how we could extend and expand our services, but we would require resource to do that.
Thank you.
Mandy, I don't know if you want to answer the second part of that.
Well, I suppose if I could just comment in respect of the adult autism side, the Trust certainly welcomed the investment from the board approximately 2 years ago for an additional 1.5 staff into adult autism service, which really has given us a total staffing complement of about 3.5 staff for the whole Trust for delivery of both diagnostic and intervention. So what we have estimated is that we have approximately capacity for 50% of referrals to be seen year on year for diagnostic assessment. And what that results in, obviously, is an accumulative waiting list in terms of time for people to be seen. The Trust has been very attentive to trying to increase our capacity to deliver work through the delivery of group-based programs in collaboration with things like the Recovery College. So connecting and collaborating with existing trust services to try and increase access for adults. But the capacity to deliver the care certainly isn't matched by the funding that's available, and our capacity does not match at all the demand into services.
Thank you. Okay, and going then finally to Pam Cameron. Go ahead, Pam, please.
Thank you, Chair, and thank you, panel, for your attendance. Your time is very much appreciated. I know how busy you all are. In terms of the Northern Trust response, I very much welcome the positive comments in support of the increased transparency involving measurable targets and tracked autism service funding. Would the Trust also see merit in the independent evaluation, scrutiny and coordination of practice-based research in problem-solving issues relating to regional consistency in service delivery in the form of an Autism Reviewer?
Thank you. And I think I've seen Julie indicating there, or was it Ciara? Were one of you indicating to come in on that? No? Okay, so any of the panel then who wish to pick up on Pam's question there around the reviewer? Yes, Jane, go ahead.
Thank you for the question. A bit like some of the other trusts, consideration would be given to existing structures, and just like I know Mary mentioned there in terms of the reviewer, and we would be keen we'd be keen to work with anyone, but if we could potentially look at existing structures, and I know some of the trusts have already mentioned about the reporting mechanisms that there are at the minute, so I suppose really that would be our point.
Yes, Mandy?
I suppose I would just like to add, in respect of the element that's about international research and looking at the evidence base, as the panel I'm sure are aware, there is a concern that the prevalence rate reported for Northern Ireland is substantially higher than other parts of the UK. I do think there would be value in investing in understanding what are the factors, and undoubtedly there are multiple factors that result in this increased prevalence rate for our part of the United Kingdom. And I do think some research investment and focus on that would have an important both public health and service experience impacts for people diagnosed with autism. Thank you.
Thank you. Anyone else want in on that one?
I think I would agree with Mandy. I think the kind of research aspect, and also looking at just Northern Ireland kind of experiences is really important. I suppose the other comment I would make in terms of a reviewer is that we do as a health system provide a significant amount of information, and do collectively share information with each other and back up into the regional coordination. And I think it would be really helpful to ensure that any reviewer function had the breadth of the Autism Act in view, in terms of looking at the wider issues in terms of issues like housing and employment and leisure opportunities, and I suppose that aspect of autism-friendly living, as well as the issue of sort of diagnosis and intervention. A wider lens, I think, would potentially actually really benefit people with autism in terms of maybe reducing the stressors that they experience in daily living, or giving them wider opportunities which would improve issues such as mental health, etc.
Okay, thank you. And listen, I do want to thank the panel for your time today and your contribution. I will, however, say this, and I want to say it with the greatest of respect, but I am disappointed in a sense, in that it would have been great almost today to hear, that here's how this bill could add to the picture going forward, or here's even better, here's why there are elements of this bill which aren't needed because we're doing A, B and C. And we do expect to hear a lot of the problems and issues coming from the sector and coming from families and individuals and that. But when we're talking to the Trust and the Department, I would like to hear more of the solutions, to be quite honest. And I don't get an overwhelming sense of urgency in relation to improvements. And I recognise that you're all under tremendous pressure, and I recognise that there are fast rising demands, and I know that some of these comments and some of these questions are just as appropriate for the department as well. But I didn't get a strong sense in terms of that we are working on a set of solutions, or that our workforce planning is taking into account how we're going to meet current needs, let alone the rising demand which you all identify and which we all know exist. So I think there's lots of work still to be done in relation to that. I think this bill is probably useful in terms of focusing and drawing that out. But I think we need to move from a situation of outlining the problems to a position where we're saying, here are what we're suggesting as part of the solutions, or indeed, here is what the resource would be required, and then you could work back from there. But if we're not measuring the right things, it's impossible then to plan as to how we address them. So I do want to thank you all. I think there's significant work still to be done in relation to this, but I think it's been useful in terms of a focus, because as we all know, this is impacting hugely out there in the community. But for now, I'd like to wish each and every one of you well, and thank you for your attendance at committee, and just to wish you all the best in the time ahead. Thank you. Okay.
Thank you.
Okay,
Thank
members,
you.
so we're going to try then as quickly as possible just to get on to the next session, then we can take a wrap up at the end of the 3 sessions. But we'll try to move on directly. I'm just checking with Clerk, are we okay to?
Yes, we have the next set of witnesses.
Okay, so we do have the next set of witnesses online, members. So we're moving then to item 7. Again, the Autism Amendment Bill, evidence now from the Department of Health and the Health and Social Care Board. And this is the 3rd of our evidence sessions on the bill today. So I'd now like to welcome by Starleaf Mark McGuckin, who's Director of Disability and Older People within the Department of Health. Mark, can you hear us okay?
I can, Chair, thank you.
We're also joined by Judith Finlay, who works within the Learning Disability Unit in DOH. Can you hear me okay, Judith? We're not hearing you there, Judith. So
Sorry,
I think we have this. There we are. Yes, we have you now, Judith. I think we had that problem the last day as well, but that's you're coming across loud and clear now, I believe. And thirdly, then we have Maurice Lesson from the Children's Services Planning within the board, Health and Social Care Board. Can you hear us okay, Maurice?
Yes, Chair, I can hear you. Thank you.
And it's Maurice Leeson, I believe.
Maurice Leeson, yeah.
Yep, thank you, Maurice. Okay, listen, I'll go back to yourselves then directly in terms of briefing. Can you maybe, I'll go back to yourself, Mark, to check, is it yourself making opening remarks, or Judith, or a combination, or indeed Maurice? Thank you.
Chair, if you don't mind, I make some very brief opening comments, and I do thank you for the invitation to brief the committee today on the proposals being brought forward in the Autism Amendment Bill, and for the opportunity to share some of the work that's already been delivered or being planned in the autism strategy, much of which aligns to the amendments being sought. In opening, I thought it would be helpful to reflect on some of the substantial progress that has been made, and also update members in the direction we're already committed to taking. Since the publication of the first autism strategy, awareness of autism has increased significantly, as has the need for services and support within our health and social care sector and wider communities. Trust colleagues have already noted earlier the establishment that each trust area now has a dedicated autism coordinator who, alongside a range of multidisciplinary clinicians, is responsible for the delivery and provision of autism services and extensive support within each area. Recognising the progress can only be achieved through collaborative working. Each autism coordinator has established a regional autism stakeholder forum, which comprises of people with lived experience, community and voluntary sector organisations, clinicians, public bodies and locally interested parties. The department has a standing agenda item on each of the forum and is consistently impressed by the collaborative work being taken forward within each area. Since about late 2018, the department has appointed staff within my directorate dedicated to raising the awareness and working collaboratively across the civil service to maintain partnership working with health and social care colleagues and wider departments. Since taking up post, these staff recognise the importance of listening to and involving people with lived experience of autism, and this engagement has informed and underpinned the actions and priorities that are being addressed. This has been pivotal in building excellent relationships and has led to the recent establishment of the Autism Forum. The forum is co-chaired by the department and 2 autistic advocates, and includes people with lived experience and community and voluntary sector organisations who support and represent them. I think it's important, Chair, to publicly thank the two co-chairs for the time and commitment they have given to the forum to ensuring that the civil servants and others involved in the development of public policy have the input from people with lived experience of autism in the development of that policy. It's our view that the strategy for autistic people should be informed and co-designed by those people with experience alongside the regional autism forums, and we believe it is these individuals who are best placed to monitor and measure progress in the implementation, delivery and evaluation of the autism strategy in a meaningful way. In addition to carrying out extensive stakeholder engagement, my officials have arranged cross-departmental workshop in 2019 with representatives from all departments to inform them of their role and responsibility in complying with the Autism Act across government. As a direct result of this initial engagement, the Department of Health is now represented on many cross-departmental working groups to ensure autism is continually considered on the agenda. I can assure members there is recognition across government departments, particularly in frontline and public-facing areas, of the support that needs to be provided for autistic people. And within our autism strategy, there are a number of actions which can demonstrate this. Just by way of a few examples, Jobs and Benefits offices have been working on a project to make sure their offices and services are more autism friendly. The Make a Call services will be working towards an Autism Impact Award. The Care Service is developing an app specifically to assist autistic people and their carers in making career choices. And the employment strategy will consider jobs and opportunities and support within the workforce for people with autism. In the last couple of years, the NICS Autism Working Group, of which the department is represented, has been formed to highlight awareness and support autistic individuals or carers of family members with autism diagnosis across the civil service. A very successful event was arranged by this group with an Autism Open Day held on World Autism Day in 2019. The event attracted over 200 members of staff with support organisations providing information and advice throughout the day. A further event was planned for April 2020. However, discussions this were paused as a result of the COVID pandemic. As we've moved to a more virtual environment over the last 18 months, a number of awareness-raising sessions have still been held with bulletins and articles, and individuals' experience of autism have continued to be published on a regular basis. Most recently, an online seminar was provided to NICS staff with over 300 civil servants registering for the event. Due to the very positive feedback, is intended to hold a further seminar in the very near future. While I focused on the ongoing work that is being progressed, on occasions the debate around the previous autism strategy and on the proposals being brought forward by the bill can often ignore this, and at times the picture being presented in comparison to the work which has been delivered seems to be noticeably different. On occasions it feels like the emphasis is on the perceived failings of the autism strategy, with minimal focus on the significant progress that indeed has been made. That said, the department has been open and honest in stating that more could and should have been done. We've acknowledged in our lessons learned report published with the interim strategy that the lack of an overarching action plan post-2017 has reduced the drive and focus for cross-departmental actions, and we must acknowledge that this lack of a robust reporting and monitoring mechanism has resulted in limited presentation of the progress which indeed has been made and achieved. However, this does not mean that the work to support autistic people, their families and carers has ceased. Actually, it's quite the reverse. Many examples have been included in the responses provided by the department and the trust, and while I can speak for much longer on the actions which we are and have been undertaken to support autistic people and their families and carers, this would only represent a small snapshot of members, but I hope you'll agree it far exceeds some of the coverage on the events that have been reported. Unfortunately, due to work pressures and recovery from the impact of COVID pandemic across the department and our health and social care sector, actions have been delayed, which have impacted on the publication of the action framework for our interim strategy, which would demonstrate a much bigger picture. However, this is underway and a subgroup has been formed within our Autism Forum who are currently collaborating on the development of measures for associated actions, and once completed, the department will be happy to share this with the committee. I'm also aware that Mrs Cameron, the Deputy Chair, wrote to the Minister to advise of her intention to bring forward the bill and share the initial proposals being considered. In the response, the Minister suggested that a meeting could be arranged with the officials to discuss the proposals, which would have allowed us more time to share the fuller picture of the extensive work that's been undertaken, and we would still be open to a meeting with the members should you wish to discuss this work. In the recent response to the Minister's response to the recent Assembly debate on the bill, on the draft bill, he emphasised that we're committing to driving change because change is needed, and that change was not being driven by legislation or the need for further legislation. The responses from the Department and the Trust before the members today outlines the work that has already been delivered and how the proposed amendments will impact on these services for autistic people, their families and carers. Chair, we're very happy to take comments and questions from members in any aspect of the papers or the wider work which is being delivered, and I'm very grateful for Judith and Morris for being here today. They have a lot more experience in this area than I have, and will assist in answering any queries from members.
Okay, thank you, Mark. And I suppose, first of all, I would like to check, has the department costed how much resource the bill will need if passed by the Assembly?
Chair, in recognising that this is a cross-departmental issue, autism is not just an issue for the Department of Health. The Minister has recently written to all executive colleagues asking them for their views on certain aspects of the bill and the impact that would have. Certainly in the responses that we have received from trusts, etc., that they are suggesting that this could be a significant resource implication, particularly in terms of reporting and recording what is being done and services that are delivered, and that would have a significant impact, but we haven't given exact cost on that yet, Chair.
Okay, thank you. And in your remarks, Mark, you rightly highlighted the fact that there is in many ways a focus on the failings, and I suppose that's natural in that's where improvement comes from. The things that are being done well are clearly welcome and in place and should be supported and are supported. But in terms of identifying, I suppose that's where good legislation does. It identifies failings and seeks to address those. So in light of that, do you agree that this bill is necessary?
I think in our response to the clauses in the bill, we have accepted the majority of them, and the work is already ongoing, which complements the tone of the bill. There are a number of issues within the bill which we would have concerns about, and they are laid out in the response before the committee today, Chair.
Okay, and in relation to the comment you made there around the other departments, do you recognise that the Department of Health are the lead departments in relation to the cross-departmental nature? And again, I do accept that there are housing, there are education, there are lots of other issues. However, as lead agency, what is your view of how other departments have engaged around the strategy?
I would maybe turn to Judith on that one in terms of the work of the forum.
Chair, I'm very happy to update in this aspect. Firstly, could I also let you know that we did send the bill out across departments to get their thoughts on it, because we're very conscious it is a cross-departmental bill. We need to make departments aware of where the responsibilities lie within it, and also to recognise the work that they're already undertaking, which does support it. In terms of recognising that it is the Department of Health leading on it, yes, we are fully we fully acknowledge that. We also, in acknowledgement of it, that sort of underpinned part of our reason to establish the Autism Forum. It underpinned our acceptance of participating in a number of cross-departmental steering groups so that we could ensure that autism was always kept in the agenda and that any actions that were being planned were inclusive of autistic people. So yes, we are fully acknowledging that the lead responsibility lies with us.
Okay, and the final one from me, and I appreciate those responses and appreciate that they've been kept fairly succinct as well, because we are under pressure of time. However, we've just done a session there with the trusts. I'm not sure if you're able to follow any of it, but the issue around measuring how many people are having to go private to get the initial diagnosis and assessment was raised. I know that the Minister had committed previously to the committee that he would look at that issue. Can you advise what engagement you've had with trusts and how this issue is being moved forward, and when we can expect to see the correct the information being gathered?
Sorry, Chair, I missed part of that question.
So in relation to, it's very clear that there's no information being gathered as to how many people are having to go private for diagnosis. The Minister had previously committed that he would look at that issue to see how that could be addressed. Can you give us an update as to what has been done to address that issue by the Department in communication with the trusts?
Chair, I'm happy to answer that question. We will be looking at that in terms of the interim strategy. There is a commitment within it to have a look at the data being collected at the moment. It is a complex process. The trusts have highlighted that they collate it manually. So we're going to have to look at ways in which we can collect that information, which may not be as straightforward as we would hope.
Okay, because again, I'll just reiterate the point I made earlier, that old saying, what gets measured gets done, is equally true in the reverse. What doesn't get measured doesn't get done, so I think it's important that we have the data issue addressed. So I'm going to go ahead to other members there now. I have at this point in time then, I'm going to first of all to Deborah, and then I'll be going to Orlia. So go ahead, Deborah, please. You're on mute, I think, Deborah. Just check your sound there for me, please.
Sorry.
Yep.
I hope you can hear me now. Thank you, Chair, and thanks to the panel. The Department's response acknowledges the need for information service and alludes to exploratory discussions of the development of a Autism Navigator role. Could you provide more information on these discussions, and would this role provide a regional service as described in the Autism Amendment Bill? And also a second question, what discussions has the Department or the Health and Social Care Board had with Research and Development, the Public Health Agency, regarding autism research needs? For example, why does Northern Ireland have the highest autism prevalence rates in the world?
Would you like me to pick up on that first, Morris? Yeah. In respect to the Autism Navigator role, I'm not sure if you're familiar with the role of Dementia Navigators, which are in place across Northern Ireland in each of the trusts. The purpose of the Dementia Navigator is to provide people with information and advice to signpost them to services and support that are available to them and dependent on their need. Now, the navigator, we would envisage this role would be similar to a dementia navigator, that they would be someone that a person could contact if they are on a waiting list, if they need advice regarding autism, if it's post-diagnosis, they need to know about services and supports and where to go next. That navigator would be accessible to them in whatever way they need them to be, whether it's to meet, to discuss by phone, on a digital platform, etc. But it best suits their needs at a time that they could perhaps be feeling quite vulnerable and unsure of which steps to take next. So we thought that it would actually be a very good role to have in place for autism. Now, I will admit it's at a very, very early stage of discussion and we would have to cost that out. But certainly in terms of signposting to services, rather than a static information service, we think that that would actually be a more flexible and accommodating role for individuals and families who may need signposting. So I hope that gives you some sort of insight into that role. In terms of research and development, what I would put to you is we have our recently established Autism Forum, and we will be looking to them for proposals for research, and we will be getting the necessary people who can undertake that research involved. We have linked up in the past year with Queen's, who were doing some research on autistic people throughout COVID, autistic young people throughout COVID, and we were able to share some comments with them. We have made contact with the Ulster University twice over the past year, but unfortunately we haven't had a response yet. But we would be very keen to find out what sort of research they're undertaking at present. Maurice, is there anything further you want to add to that?
Yeah, Chair, if I could just make 2 points. The first one is that Judith has indeed asked that the board do some early scoping into how much a navigator scheme would cost and to give some ideas about how it would work in practice. So that has been, we've been asked to do that and we will carry that out. And just to make the general point in terms of collaboration with the Public Health Agency, we work very, very closely with the Public Health Agency across all of the work that we're doing. And the Public Health Agency in fact co-chair our Regional Emotional Health and Wellbeing Framework Group.
Okay, thank you.
Thank you. Thank you, Deborah. Orlia?
Thank you, Chair, and thanks to the officials who's came to committee today. So just a couple of questions. I wanted to ask, the Human Rights Commission have said that they're seeking to strengthen Clause 1. So it'll be completely clear that the department then will have to and should consult with people with autism, parents, carers and the community and voluntary sector. And I know it was touched on there just in the last answer around some of the consultation that the department is carrying out. But it was just to maybe ask for your views on that recommendation that the Human Rights Commission is seeking in strengthening that first clause. I'd also like to ask how the Department of Health has done any work with the Department of Education to try and address some of this back and forth that children are being placed in when they're trying to access support. There can be a back and forth between education and health. So I'm just wondering if you have had any specific conversations with the Department of Education to see how you can streamline some of that. And then just finally, I wanted to ask in the department's response, it was stating the importance of implementing the emotional wellbeing service framework for children and young people, and obviously all of the different things that could try and address. I'm just wondering how you can explain the relationship between the emotional wellbeing service framework and as we know how data status.
Okay, Maurice, do you want me to pick up on the first two questions?
Yes, and then I'll take over. Yeah.
Apologies, you were breaking up quite a bit there, so I hope I've caught all of this. In terms of the Human Rights Commission, as they were speaking this morning, I was continually nodding my head because what they're suggesting is very much the approach that we have been taking. Since being appointed to this post, along with my colleague, we have been determined from the outset that anything we did would be informed by autistic people, their families and carers, and also by the community and voluntary organisations that represent them. So we spent an awful lot of time doing a lot of stakeholder engagement, particularly over the first year. And if you're familiar with the autism strategy, you'll see that we provided an annex of that stakeholder engagement and the topics that were covered. We just feel that autistic people and their families and carers are entitled to exactly the same rights and access to services, supports, community availability, recreation, employment as everyone else. And when we were developing the interim strategy, what underlined it was we felt that society needed to adapt to the needs of autistic people rather than autistic people needing to adapt to the needs of society. So this has very much underpinned everything we have done. And our interim strategy is very much setting a direction that, whilst we recognise there is a very important health application that needs to be made for obvious reasons, there is a whole wider picture, and Dr. McMeekin actually put it very well. She referred to it as the wider lens, and we think that that is something that really needs to be addressed. We need greater understanding in our communities and in all of our workplaces and organisations, and we need autistic people to be supported more within their communities. And a lot of our councils are recognising that and working towards autism-friendly council status, which then cascades into business, employment, recreation, to ensure that they're supported. So I hope that provides some reassurance in relation to that question.
Judith, could I maybe just add on that as well? It would obviously, given that this would be a cross-departmental strategy, and would have, autism would be cross-departmental, would have impacts on other departments. We would obviously need to see what the exact text of what the Human Rights Commission were suggesting, and take views from other departments as well on the impact that would have on them. But as Judith said, we've been committed to engaging with people and carers and organisations of autistic people from the very start of this. So, sorry, Judith, to interrupt there.
No, not a problem. I think when our action framework is published, you'll probably see evidence of that as well. In relation to streamlining the interfaces between the Department of Education and Department of Health, we actually now have what's called a Special Educational Needs Steering Group, which is co-chaired by the Department of Health and the Department of Education. And one of the aspects of that steering group is to try and improve the access to support within education that is dependent on need rather than a diagnosis. So we are very much looking at how those services can be streamlined and how we can improve those interfaces. And there is a special educational needs framework which is being implemented, and I think that will very much work towards addressing a lot of those issues. But certainly over the past 2 years, there has been a much stronger and much more integrated working approach between the Department of Health and the Department of Education. And if there could be a positive from COVID, it has been that that relationship has actually strengthened, because there has been so much interagency working to try and address the problems that were arising, particularly with children who needed additional help at school throughout the pandemic.
And if I can pick up the question then in relation to the emotional health and wellbeing framework, which and we have a regional group which supports that. That regional group is co-chaired with the Public Health Agency and is inclusive of all the trusts and education. Our purpose there is to look across a broad range of both autism, ADHD, emotional health and wellbeing. We're looking to integrate and streamline the systems that are there operationally. We're very conscious of the fact that for some families they can wait for an assessment in terms of ADHD and maybe be told then that they need actually an assessment for autism and then have to move to a separate waiting list. So we're looking to streamline that, have one single point of entry, and you would have heard some of the trusts refer to that in the previous session, so that, as I say, there's one way in which families can enter our system, have their assessments, and then have access to support.
Mm-hmm. And it's probably also worth noting that education are represented on that group as well.
Thank you, Judith. Thank you, Maurice. Thanks very much.
No, thank you.
Thank you, everybody. And then Pam Cameron, go ahead, Pam, please.
Thank you, Chair, and thank you, panel, for your attendance at committee today. Much appreciated. Just a couple of questions for you, and obviously my colleague Deborah's already touched upon research, but do you as a department agree that the independent research is vital to exploring more efficient working practices so it can pay off in the long run in human and financial terms? And I give as an example again when the Health Minister was questioned about the rates of private ASD diagnosis and its impact on the disparity in ASD diagnosis across NI, the Minister responded that the department could not answer the question because it was not collecting the data. And on the back of that question, it just strikes me that we're talking a lot, and Orlea has mentioned it as well, in terms of that collection of data and question the trusts and how they collect data on private autism diagnosis, for instance. And I'm just wondering where Encompass is in all of this, because we haven't heard about Encompass for an awful long time, and you may not be the right people to ask today, so I appreciate if you could even take that back to the department. But I mean, obviously Encompass should really improve how we do everything, how we transform and how we collect data and how we use that data and how we plan for the future going forward. So I'm just wondering if you have any update around Encompass, where it is, why we haven't heard about it for so long. I think since the pandemic has come about, I haven't heard about Encompass at all, and that would be a huge concern of mine. So if you wouldn't mind answering those questions.
Would you like me to pick up on that?
Yeah, and I'll say something about Encompass.
Good. I'm afraid my knowledge is very limited around Encompass, other than when data is discussed. I am usually told that Encompass may address this once it's introduced, but I'm afraid I'm not familiar enough to discuss it. In terms of the research, I do agree that research is required, and independent research. Yes, it is required. I think what we need to do is very clearly identify what research is required. I think possibly one of the aspects of the previous strategy was, and I'm going on what I have learned from that, Deputy Chair, because I wasn't in the department at the time. There was a lot of research being discussed, but I think just given the climate that we're now in, we need to determine what research is needed. And once we determine what research is needed, then I think we should pursue ways of looking at how we can do that. And I think that is something that we really will need to consider as part of the longer term strategy.
I'm sorry, I just wanted to say that I'm not an expert in Encompass either, but just to reassure Committee Chair that work continues in terms of the development of Encompass and that community services are engaged with that.
Okay, thank you. Okay, so moving on then to Colin McGrath. Go ahead, Colin, please.
Thank you, Chair. Chair, just a question about the issue of gathering of data and the sort of reliance maybe that there's still there from the department in terms of using education as the main place for getting the information, whereas the 2011 Act suggested that maybe the department should be trying to gather that information. Is that something that the panel would be aware of, and is it something that they're seeking to address?
I think in terms of the prevalence of data in education, it's trying to get the data set that the data can be extracted from that is probably what underpins it all. I'm not a statistician, so I can't really tell you any more than that. I can certainly look into it in the department and provide a written response to you if that would be helpful.
Okay.
Yeah, because I mean, it is part of the 2011 Act that the department is to comply with that. So if it is just simply using its own education data, then it wouldn't be operating fully within the guidelines of that. So it would be good to just find out just what has been set up, just to check that we are sticking to that guideline.
Yeah, we're not solely getting data from education. I mean, there is the annual prevalence of autism in school-aged children report, which comes out. But any additional data, and we publish a fairly comprehensive set on the department website. The Department of Health Statistics Unit and the Health and Social Care Board work together with the trusts to provide that data. So, we are meeting some of the responsibilities that are stated in the Act.
Yeah, just to confirm really that the Health and Social Care Board does collect from the trusts really data relating to waiting times returns, so there is information gathered here as well.
Okay, well, if you probably just drop
Colin,
yeah, okay, thank you very much. Thank you.
Thank you. Yep, thank you. Alan?
Thank you, Mr. Chairman. I'd like to commend the department for the work that they've done to date on this very important issue. And it's great to see that the department has committed to developing measurable targets through the Autism Forum, from which the autism strategy can be assessed. Does the department have a set of approved measurement tools that it is required to apply routinely in monitoring actions that fall under the watch of the Programme for Government? And did Mark say earlier that these could are or could be submitted to the Autism Forum subgroup for comment? Thank you.
If I could perhaps pick up on that, thank you for the question. We do have a set of measures that are produced under the programme for government. It's called the Outcomes Delivery Plan, and it bases measurements on what has been done, what the action has been, when it has been done, what difference it has been made, and who did it. And a lot of it is based on collaborative working as well. And we have shared those measures with the subgroup that we have from our Autism Forum. And in fact, one of the people who is in our Autism Forum is actually our Outcomes Delivery Plan contact in the department. So we're being very well advised in that. However, it's making it workable as well, and it's making it easily understood. And the measures that we might propose as government may not be those that the community and voluntary sector want to see either, where they might want to see a specific number of autistic people have been addressed through a specific programme. So, you know, sometimes the evidence that we need to provide is more qualitative as opposed to quantitative. So it's just trying to get an understanding of that. But yes, we will be working, as departments are supposed to, towards the Outcomes Delivery Plan targets.
Thank you.
And I think as well, you will have picked up from the submissions from the Trust that very much in terms of developing an outcomes framework, pointing to a willingness to be involved in that, and then also identifying some of the other stakeholders that would be important to be engaged in that discussion.
Thank you.
Thank you. And finally then, Carol, go ahead, please.
Thank you, Chair. Sorry about that. It just took me some time trying to get myself off mute. So I just want to thank the panel for their contributions. But just, I mean, it may be a simple question, but for me it's a really important one. What do you all believe as being the underlying reason for amending the Autism Act of 2011, and does the department believe it needs to be amended?
I maybe take that one, Chair, if I can, and try and cover the members' questions. We believe we are delivering significant elements of what we're supposed to be doing in terms of the autism strategy. I've already reflected that there's been delays. We know more can be done, Carol, and we're trying to do more, and we're trying to develop more, particularly around the Autism Forum and the work of the Forum. I think is a significant step forward. We have published the interim strategy, and we're working towards the full strategy by March 2023. We're trying to eke out more resource to put into this. As with all departments, we're struggling at the minute in filling vacancies, and that has impacted our ability to deliver some of these aspects, but we are working towards putting additional staff on this. We recognise the importance of it, and I do believe that the interim strategy and the full strategy for 2023 will significantly move forward our responsibilities under the Act.
Okay. Carol, go back to you now.
Yeah, so, I mean, obviously, so I'm respecting what you're saying, Mark, but the issue is that from 2011, I think people have been very generous, particularly families and that, and certainly advocates around, you know, the implementation of the 2011 Act. But there obviously are gaps, and I think everybody's come from a place where they want to try and ensure that those gaps and those needs are met. But unless there's legislation, our experience has been it'll depend on budgets. So that's the reason why we are taking so much evidence and providing so much scrutiny and support to this, because I don't think anybody wants any child or any adult left behind. So primarily, that's the reason we're asking them. Come back to the point that Alan said, it is critical that not only is it in the programme for government, but when the department do their screening and hopefully their full equality impact assessments, that this issue will be raised, because we're sitting with children for a 3-year wait for diagnostic services, and for adults it's a 5-year wait, and I don't think anybody wants that to continue. And we heard from the Belfast Trust, annually the increase is now 70% compared to where it was before. So there's no saying that's easy at all. So it's quite obvious from my point of view that the amendment to the legislation, and hopefully the statutory duty and obligation to meet those amendments, will be certainly met by the department, and indeed cross-departmental where appropriate. Thank you.
Thank you, Carol. Okay, listen, that's all the members, and I'd like to thank the panel for your remarks, for your presentations, and for your answers to the questions of panel members. And we can carry on then with our consideration. But thank you for that, and please all take care in the time ahead. Thank you.
Thank you, Chair.
Thank you.
All right, all the best, Mark, Judith, and Morris. Good luck. Okay, members, thank you. So I guess there is a lot of information there, and the clerk, I'm sure, has quite a bit of follow up there in terms of some of the questions and some of the information that has been committed to be sent forward. So, is there any other comments from members, just very, very briefly there before we move on? Pam?
Yeah, thanks, Chair. Sorry, I was trying to get back in there before the officials left there, because I was trying to check up on my records. I think it was Mark referred to an offer to meet with the Minister or officials on the back of the request from myself, or the inquiry around the original letter about the private members bill. And I don't have any recollection of an offer to meet with either the Minister or officials. I mean, I stand to be corrected, but I wonder, could we follow up the committee on that? Because certainly anything I have in writing doesn't have any such offer to meet, and obviously I'd be very open to more engagement on the subject.
Yep. Members content with that? Yep. Carol, I see your hand up, just checking that from previous, or do you want to make a brief comment?
No, sir. So, Chair, the brief comment was that Mark had said that he hadn't seen the human rights advice, and I'm assuming any bit of legislation will be sent to Human Rights Commission for comment in the Equality Commission. But would it be appropriate, particularly the first evidence session that we heard, there was a lot of really, really good information there that's sent to the department to make sure that they have possession of everything that we do?
Yep. Members content with that? Yep. Thank you. Okay, members. Moving on then, and I'll just double check with clerk. Do we have the next officials online?
Yes, sure.
Yes. Okay, so members are going to have to move on quite swiftly then to the next item to get through the business today. And item 8 there is SR 2021/293. So this is an SR on international travel, COVID restrictions. Department officials are here to brief the committee on the provisions of the SR, and I refer members to the clerk's memo at tab 8.1 of the pack, and to the other SR papers at tab 8.2 and 8.3. And I would now like to welcome to committee this morning Mr. Justin McKay, who is in the International Travel Directorate. Can you hear me okay, Justin?
I can indeed, yes. Can you hear me, Chair?
Yep, hearing you loud and clear, Justin, thank you. And Ms. Deborah Sharp, who is Deputy Head of Health Protection in Branch 3. Can you hear me okay, Debbie?
I can, Chair, thank you.
Okay, and both headsets on, so that's great. The sound is good there, and if we could just remind people to stay on mute when they're not speaking. But without further ado, I'll go then back to Justin, I believe, to lead the briefing there this morning, or this afternoon, sorry. Go ahead, Justin, please.
Yes, good afternoon, Chair and members of the committee. Thank you very much for the invitation to attend today's meeting. The regulation for your consideration today is Statutory Rule 2021 number 293. This regulation underpins the Executive's agreement to align with the UKG and the other devolved administrations in relation to the introduction of a new global travel task force framework, as well as further relaxation of border measures in relation to international travel and the cyclical review of countries, the outcome of which takes into consideration detailed analysis of risk undertaken by the Joint Biosecurity Centre. If the committee is content, I will go ahead and summarise the content of the statutory rule.
Yes, please do.
Okay. SR 2021 number 293 the Health Protection Coronavirus International Travel Operator Liability and Information to Passengers Amendment Number 8 Regulations Northern Ireland 2021. Okay, this regulation was made to amend the circumstances relating to mandatory testing after arrival in Northern Ireland by introducing an option allowing eligible arrivals to complete a lateral flow device, an LFD test, on or before day 2 of their arrival in Northern Ireland when not having visited a red list country in the previous 10 days as an alternative to the polymerase chain reaction PCR testing that was in place beforehand. If an individual receives a positive LFD test, they will be required to isolate for 10 days from the point at which they receive their test result and take a confirmatory PCR test. This confirmatory PCR test will be provided free of charge. This change came into operation on the 31st of October 2021. The regulations also amend the definition of the transit policy to ensure that passengers who remain on board an aircraft or vessel without travelling through a country, or passengers who change aircraft without passing through immigration control, are not treated as having departed from or transited through that country or territory. So, for example, if a passenger landed in a red list country and travelled onwards to another country but didn't go through immigration control, they wouldn't be deemed to have departed from the red list country. The regulation also removed the remaining 7 countries that were on the red list. They were Colombia, the Dominican Republic, Ecuador, Haiti, Panama, Peru and Venezuela from the 1st of November. The regulation does not remove the requirement for the red list from statute, but the red list remains there if the need arises to put countries back on it. It just currently means that there are no countries on it at the moment, and this is reviewed on a 3-weekly cycle. To include those passengers participating in COVID-19 vaccination clinical trials that has reached at least phase 2 or phase 3 of the trial, regulated under the European Medicines Agency, or a regulatory authority which is designated as a stringent regulatory authority by the World Health Organization, to be deemed fully vaccinated for the purposes of international travel. So anybody who's reached phase 2 or phase 3 of the trial could be seen as being fully vaccinated as well. They have to provide proof of this through a participation document, and it should also be declared on the passenger locator form. The regulation also amends the circumstances where an individual is fully vaccinated if they receive a dose of an authorised vaccine in a relevant country and 1 dose under the UK vaccine rollout overseas, as listed within the regulations. The regulations therefore then add the definition of what the UK vaccine rollout overseas means, so that people vaccinated in these territories with proof of vaccination from, for example, the NHS COVID Pass or the EU Digital COVID Certificate, then they also meet the requirement of the fully vaccinated policy. These territories are deemed a relevant country in addition to the countries that are already listed within Schedule 12 of the regulations. The individual is also deemed to be fully vaccinated if they received a dose of the approved vaccine in a relevant country and a dose under the UK vaccine rollout overseas. The regulation also expands the list of relevant countries under the fully vaccinated policy to an additional 35 countries. They are Argentina, I've got the list of them here. They're within the regulation. There's quite a number of them. So there's Angola, Argentina, Armenia, Azerbaijan, Belize, Bermuda, Botswana, Cambodia, the Cayman Islands, Costa Rica, Djibouti, Eswatini, Gibraltar, Guyana, Honduras, Lebanon, Lesotho, Madagascar, Mauritius, Mongolia, Nepal, Occupied Palestinian Territories, Panama, Peru, Rwanda, Seychelles, Sierra Leone, Sri Lanka, Suriname, Tanzania, Trinidad and Tobago, Tunisia, Uganda, and Uruguay. And also really the last thing that the regulations were doing was also removing the requirement to complete a passenger locator form for the seamen and masters, pilots, maritime, ship inspectors and aircrew categories of worker if they don't come into contact with other passengers, and to introduce an exemption from the requirement to complete a PLF for transit passengers if they don't pass through immigration control, and road haulage workers. So that hopefully, Chair, is a brief summary of what is included within the statutory rule. Happy to take any questions.
Okay, thank you, Justin. A few from myself then. The first one is, and maybe I'm reading something wrong and I stand to be corrected, but I'm just wondering, is there a drafting error in Clause 6 as it relates to Schedule 2B, which is the criteria to be an eligible arrival? The SR omits subparagraph 2C, but 2E refers to the requirement of 2C and is still in place. So I'm just wondering, is there a drafting error in that?
Chair, if you don't mind, I'll come in there. It's Deborah here. Yes, you are correct, and that has been picked up and is actually being amended as we speak in the draft regulations that are being drafted at present.
Okay, thank you. Okay, well that's good. In terms of Clause 7 then, why edit the information requirement for sea and air transport staff to remove the condition that they had no access to passengers? Why has that been changed?
Sorry, Chair, I'm just having a look through my notes on this.
So
Can I just ask you to repeat the question there again? Sorry, Chair, which category was it?
Yeah, the information requirement for sea and air transport staff to remove the condition that they had no access to passengers. Why edit that information? Why is that information requirement changing?
Okay, I'm unsure if you know about that, Debbie. Either we might have to come back to you on that, Chair.
I'll give a brief synopsis of the sort of rationale behind this proposal, and it was to do with those categories of workers that will be coming into Northern Ireland and other regions of the UK. So whilst there was a requirement for them to complete a passenger locator form if they are within sort of passenger carriages, etc. However, operationally there was some difficulty with getting access to some information by PHA in Northern Ireland and the UK HSA. So it was agreed between those respective organisations that passenger manifests are already provided to PHA and contact tracing bodies, and they are deemed a bit more efficient in terms of timeliness and the information gathered on those passenger manifests, and they were deemed equally effective, if not more, to quickly gain access to contact details of passengers arriving. So they, rather than have the duplicate information being received, they introduced this blanket exemption for those limited sector categories.
Okay, thank you. And then in terms of the LFT test, will that be as sensitive as the qualifying tests already within the international travel regs at Schedule 5? Which reflect at 5.1, they reflect a sensitivity of at least 80%, and at 5.2, a specificity of at least 97%. Will the LFT tests match that type of quality?
Yeah, the test device used must meet the relevant quality standards, within CDTA law, and be marked and used in alignment with MHRA target product profile scope. So that has been put in through as a requirement of the tests, and it must also be a non-nasopharyngeal test if being used as a self-administered test. So those are within the regulations that they have to meet that minimum criteria.
And does that criteria match the criteria set out within the regs that I referenced there, 5.1 and 5.2, Justin?
I'll need to come back to you on the details of that. My understanding is that yes, they do, but I would like to just clarify that as a follow-up to this meeting, if you don't mind, Chair.
Okay, and then the final one for me just is around the issue of testing at home, and I suppose there is guidance in the clauses around home testing, and it says that point of care tests are to be performed by a professional in a health or social care setting. In relation to that, then, can you confirm that the LFT test will be that at what location a person will be required to take the test at? So will that be in a test centre, a GP or a healthcare setting, or where do you envisage the LFT tests taking place in support of this?
No, the LFT test can be taken at home as long as the traveller can take it and upload the photograph within 15 minutes of the actual test result being taken.
Okay, so within the guidance, it references and written into the SR that it doesn't consider tests for use at home. So there seems to be a contradiction there, to be quite honest, in terms of that it's in the guidance in one place, but in this situation then it's going to be not taken as within the guidance. Debbie, do you have any...
Can I just clarify, Chair, which guidance you're referring to? I mean, in terms of tests for international travellers, the booking process for that is they would book those tests online to be delivered to their home address, and that has been the case since the introduction of that policy in terms of post-arrival test kits, and it's the same for the introduction of LFD tests, so that the traveller would book this in advance of their travel to Northern Ireland, and their tests would be arriving with them shortly after their arrival home or at their location where they're staying in Northern Ireland. And the guidance that we have on NI Direct would clarify that. So can you just let me know?
So the most current guidance in SR Clause 3C references the Medicines and Healthcare Products Regulatory Agency for laboratory-based SARS-CoV-2 PCR tests. And that guidance states this Target Product Profile, or TPP, does not consider tests for use in the following possible scenarios, and it then lists self-tests for use at home as one of those bullet point lists. So if the guidance referenced and written into the SR says it doesn't consider tests for use at home, how then later in the SR can it enable LFD? And what I'm actually wondering is this as a result of a cut and paste, where that hasn't married up correctly.
I think we'll need to take that just in a way, Chair. Apologies, and we can certainly come back to the committee once we've scrutinised that.
Okay, thank you. Okay, I'm going then. I see an indication from Paula as well, so I'll go across to Paula for a question, please.
Thank you, Chair, and thank you, panel, for the update today. My question is in relation to those people who test positive on the lateral flow test, and under Form B, page 7 of the bill, it says that you may be contacted for contact tracing purposes if you're meant to be self-isolating. I'm just wondering, is that still happening? At what degree are we getting some data back in terms of how often people are and how random it is and how many people are being caught out not self-isolating?
I think if I can just take that, the private provider is really responsible for reporting all the test results to the UK HSA, and then they get passed on to our own PHA. So those details, I wouldn't have to hand, but I think that they are certainly captured, and I couldn't give those figures at this meeting, but it's something that we could follow up on.
Yeah, no, I would appreciate that. I just would like to know the extent to which, the ferocity at which people are actually being checked up on, and obviously PHA have only got certain powers, and whether there's any involvement then with police in terms of checks from them.
Paula, I'll just come in briefly as well to add on to what Justin said. So Northern Ireland still has a process in place where a company called Cytel contact arrivals into Northern Ireland that are still required to self-isolate, and that would be people that are not deemed or do not qualify as fully vaccinated. So there would be phone calls made to those arrivals to verify their compliance with the self-isolation requirements. And if there is a concern from their end that a passenger is not complying, then that would be referred to the PSNI for physical follow-up. In terms of sort of checking of fully vaccinated arrivals, because the requirement to self-isolate no longer is required for that arrival, then there's no contact with those arrivals, but there still is a mechanism whereby we can check that people are complying with what they need to comply with.
Okay, no, that makes sense. But even if we could get some additional information then in terms of, how many people have been caught, etc., would probably be useful to see how effective that mechanism is. Thank you.
Okay, thank you. And I'm just checking then with the clerk.
For another week.
Okay, so listen, we do have a little bit of additional time. There are a number of queries there that you have committed to coming back to us on. So I think we should then maybe defer consideration of this just to allow you to come back with that additional information to us. Okay, so thanks Justin and thanks Debbie for your presentation and addressing members' questions there, and we can move on then with our further consideration. Thank you.
Thank you.
So members, are members content then that we just pick up on this again when we receive that additional information back at one of our meetings next week? Yep. Okay, thank you members. So members, moving on then to correspondence, item 9. Which is at tab 15 of the pack, and there's a couple of items that I'd like to draw members' attention to. First of all, item 9.2 is a departmental response to the committee's request for further information following the October monitoring briefing on the 30th of September. And bear in mind, members, some of this correspondence has been rolled forward from last week, given that we had to roll some of that forward with time pressures. So, departmental response to the committee's request for further information on the October monitoring. Do members have any comments they wish to make in relation to that? I see a hand up from Carol and one from Pam. I'll check with you both there. I'll go to Carol first. Carol, go ahead.
Yeah, Chair, it's really just on equality screening, the EQIA stuff. I mean, given the fact that we are, going into multi-annual budgets, albeit 3 years, I would still like some more detail from the department, because it says here, remain from the Minister. So committed, so the department and the Minister remains committed to working with executive colleagues to secure additional funding. And it says we will complete appropriate equality screening and EK and the budget allocation. So, while it says that and it would read that that's going to happen, can we make sure that it isn't the equality screening and that's it done, that a full EQIA will be done as well as an equality screening exercise, given that it is a 3-year budget? Thank you, Chair.
Yep, members content with that proposal? Yep, thank you. And Pam?
Yeah, Chair, similar to Carol, it just seems to be the department have battled away the issue of the equality screening for the pay award on the basis that the independent body was responsible for ensuring the appropriate considerations. So I'm just thinking maybe this is an area that the committee would want to write to the pay bodies about.
Yeah, members content with that proposal? Yeah. Okay. The other item then that I wanted to flag was, so a couple of actions coming from that. Item 9.3 then is a departmental response in relation to child and adolescent mental health services. Do members have any comments in relation to that item?
Yeah, sure.
Yeah.
No, just quickly, it was just, I know it was in last week's PEC, it was just obviously to welcome the response that we got back from the department. I think we had originally requested that information. It was like back in May, but anyway, it came eventually, and I know that they've said that they're going to keep us up to date with those monthly reports as well on the stats and the figures. So it's just to keep an eye out for them, and just think it's a good piece of work getting those regular updates on those stats.
Okay, thank you. Any other comments, members? No. Okay, thank you. Moving on to item 9.8, which is from the Minister advising that the Department intends to make the Health Protection Coronavirus Restrictions No. 2 Regulations NI 2021, which will consolidate existing coronavirus legislation and will contain provision for mandatory COVID status certification. Although this will not be commenced at the point the regulations are made, the Department advises that the inclusion of the provisions in the regulations will allow them to be commenced at some future date, if and when the Executive makes such a decision. Do members have any comments to make in relation to that item? Yeah, go ahead, Pam.
Yeah, I'll have a comment on this, but also on the previous item I was trying to get back in as well, which is to say, there obviously is grave concern over those figures in terms of CAMS and obviously the effect that lockdown has had on those figures, and that's very worrying that the figures are so far down. I think it's just a lesson to be learned, I think, into the impact that this has possibly had on children in particular. But in terms of this item, Chair, I mean, obviously the detail, I welcome the detail, and it talks about the three different methods to certify whether fully vaccinated, providing negative lateral flow test within the last 48 hours, or that positive PCR result between 30 and 100 days prior. And it also talks about applicable venues, which are the large events, hospitality and nightclubs, cinemas, theatres and other such venues. And I'm just wondering, given events have overtaken us as of yesterday, and we're now talking about COVID certificates for coffee shops, and I'm just wondering where that fits in, because it seems to be a long way from a large event or a nightclub where there are effectively no restrictions anymore. So I can understand where the logic would apply to wanting to bring in a COVID certificate for a nightclub that has no restrictions, that can't have restrictions, but coffee shops. So I wonder, can we write to the Executive Office and the Health Minister and ask then how we've gone from large events, hospitality and nightclubs, cinemas and theatres and such venues to coffee shops? I'd like to see the evidence behind that, please.
Okay, members content? Yep, members content with that. Yep, thank you, Pam. Yeah, I suppose just my own comment is that it will be I think crucial to see what is being proposed, given the fact that there is a very dangerous and difficult situation ongoing. Clearly, we need to look at how we're going to manage this winter period. I know the certificate has been put forward as one element, but I think there are significant there are a range of things. We need to make sure that every element of the toolbox that we need to deal with COVID-19 is in place and is robust, including right back to the basics of find, test, trace, isolate and support, including communications and clear communications. I think those are all important elements. So that's okay. Moving on then to item 9.11, which is from the Children's Commissioner in relation to Child Mental Health Week in February next year. Checking if members have any comments, but if members are content with Nicky's proposals, also to ask if they're content for the clerk to take arrangements forward in relation to that item. Members content, I think, yeah. Thank you, members. Item 9.18 is a response from the Medical Practitioners Tribunal Services to the committee's request for a briefing. Have members any comments to make in relation to that item?
Yeah, Chair. I mean, basically, we're still none the wiser. I'm sure most of us have seen the correspondence that they sent back in response to one of the former patients of Dr. Michael Watt. And to be honest with you, I just think we need to get more information here. What is their threshold? What is in the public interest? We're not asking to see the whole intimate details, but we are asking what the criteria is and what the public interest threshold is. And to be honest with you, it is a statutory committee of the GMC, and I do think there needs to be more transparency and more accountability.
Yeah, members content with that, and I know we have a number of additional strands of inquiry that we have opened up ourselves, but are members content with that we seek further information on the criteria involved there? Yeah, members content, thank you. Just changing the gallery view here, members. The other issue that I wanted to...
I found this on the web.
Well done, you. You weren't asked to find it, but anyway. So members, moving on to item 9.18, 9.21, is correspondence from the Neurology Recall Support Group, thanking the committee for its work on this matter and asking to be included in any future correspondence. Now, we have already agreed that we will publish the briefing papers we've received and continue to publish any letters and any information that we feel is relevant. And we're dealing with a lot of different groups across a lot of different issues. So I suppose that it's really, you know, we just can't copy every group into every piece of correspondence. It would become unmanageable. But do members have any comments they wish to make in addition to that? And are members content that we continue to publish the relevant information online and for groups to access? Yeah, thank you. Any other items of correspondence that members wish to highlight? No, that's fine. And are members then otherwise content with the actions on the correspondence list? Yeah, members content. There's no items of correspondence in tabled papers, members, so moving on to the forward work programme, I refer to the forward work programme at tab 10.1 of the table pack. Are members content to note? Paula?
Chair?
Yes, Paula?
Chair, I've noticed that that there's a lot of informal health committee meetings on a Tuesday lunchtime. I'm on the business committee, obviously health committee is a priority, but I'm just wondering, is there an alternative time when we can be scheduling these, see Colin's there as well, is there an alternative time that we can reschedule these, because obviously they're both important to be at? Thank you.
Yeah, and I think we have taken a look at this, I think, on several occasions, but I'll just check with the clerk. I don't know if there's maybe a way to do a doodle poll or something to see if there's a better time, but I guess the minute we move it to other slots, we're going to hit members. We're all probably conscious of how busy we are. We're all involved in a lot of all-party groups and a lot of other meetings, a lot of assembly business, which we're all involved in as members of the Health Committee as well, currently and in the weeks to come. So I'll just check with Clerk what his thoughts are on that.
Thanks, Chair. Certainly we looked at some times. As the Chair has mentioned, Mondays and Tuesdays are very busy with health-related debates and issues in the Chamber. So really the only options are probably on a Monday or Tuesday, which would more than likely mean eating into plenary time for some members as well. The Tuesday lunchtime was thought that it was almost the best option, but I'm certainly happy to take views from members if there was any other suitable times on a Monday or Tuesday where we could schedule something in, because that's part of the issue too, is we need to schedule these in advance and can't really change times each week, so it's finding something that maybe suits maybe not all members but as many members as possible. But I'm happy to take any emails or phone calls in relation to other suitable times. Yeah, the other element.
Chair.
The other element, Paula, I'll bring you back in a wee second there. The other element, I suppose, just that 1 to 2 p.m. slot is really the only fixed and certain time within those couple of days where members are available. But I do recognise that it's particularly difficult for members of the Business Committee. I do wonder, is there a way for sort of almost between you to share it out in terms of one of you attending the Business Committee and one attending the Health, but that's up to yourselves. But I recognise it's difficult. I'll go to Paula and then Colin, or Pam, with Pam as well indicating. Colin's not.
Chair, I suppose it's relating to next Tuesday, the winter pressures with the Royal College of GPs and the BMA. It is a session I would particularly like to be at, and I noticed that is there any other session that we could fit it into? I just think that I don't want to miss it, basically.
Okay, I'll take a comment from Pam. I'll take a comment from Pam then, and then I'll check with you, Colin. I'm not sure if you're looking in or not, but Pam, go ahead, please.
Chair, thank you. And obviously it is very difficult, and I think we're the worst off out of all committees, Chair, for pressure of work in terms of the time we have to be in the chamber and time we spend in committee and actually reading committee papers. But I don't see a better option other than what has already been proposed. I think the Tuesday option is probably the best, and I did clear other meetings to ensure that I could be at that, and I understand the difficulties with the business committee, but the only thing is at least it is usually fairly short meeting at business committee, and perhaps maybe party colleagues could just allow for their absence at those meetings, and given it's in the short term, it's the only option really we have to be guaranteed a slot. And I think it's really important that that witnesses get the maximum attendance from this committee as well at those Tuesday meetings, in terms of being respectful and ensuring that we hear from everybody that we want to hear from.
Yeah, we can't really, once we have asked people to come in on the slot, and Keith has already outlined that we have to have the slot booked for broadcasting, for booking the rooms, then we invite the members, and then starting to move those around becomes a huge logistical problem. Colin, I wanted to check, I'm not sure if you were looking in or not.
Sure, just relatively, we'll try my best to be as many of those as I can, but I suppose it is worth noting that, I don't know if with 6 parties represented on the committee, if 1/3 of them are committed to saying that they can't make it Tuesday at 1 o'clock, that we can say that that's an acceptable time. It's clearly not. 1/3 of the parties represented in the committee can't make it. Now, whether we can amend so that we can make it, that's something that can be sorted out, but it is a timetable clash, and it will need resolved.
Okay, well, if members want to flag on any suggestions to the clerk, and then the committee, I suppose, can look at that overall, and committee can take a decision on how best to proceed. But it is difficult, and it's not getting any easier as time goes on, and we just cannot keep putting additional sessions on and trying to ensure members can make them, because it's each and every one of us are busy as a result of constituency and committee and assembly work. Okay, well, listen, members can forward that through to clerk. Okay, any other business then for today's meeting, members? No. Well, then I will go to the date, time and place of next meeting. Our next meeting will be on Tuesday, 23rd of November 2021 in room 30 at 12:45, when we will have a briefing from the GPs on winter pressures, and notwithstanding the discussion we've just had at this point in time, that's the schedule for the next meeting. Okay, thank you, members, and all take care, please, in the next while. Thank you.
This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound.